Good morning, everyone, and welcome to the Council's Tuesday, October 12th session. This morning, we only have one proclamation. We're recognizing Bullying Prevention Awareness Month, and I want to turn it over to the Chairman of the Education and Culture Committee, Councilmember Rice.
Thank you very much, Mr. President. Really appreciate that. And I'm joined today by John McCarthy, our Montgomery County State's Attorney, and very happy to have him with us. I wanted to start off by saying that even during the pandemic and with our children out of school for a long period of time, folks thought that bullying stopped. The reality is that we know with social media, we've seen it with some of the most egregious stories, that bullying continues online and is pervasive in many of our social media outlets. And it doesn't stop just at the childhood level or the adolescent level. The reality is it goes well on into adult years if unchecked. And it's our responsibility to make sure that as stewards that we continue to profess social and emotional learning, something that the MCPS Be Well 365 campaign and being better social stewards is something that we're trying to make sure that we instill in our children. But the reality is that they're still bad actors, unfortunately, and children who make bad decisions. And so we needed to make sure back in 2008, when I was a state delegate, that we sponsored bullying prevention legislation that allowed for us to make sure that all schools throughout the state of Maryland addressed preventing bullying, harassment, and intimidation. Still to this day, it's one of the most comprehensive bullying prevention laws in the nation. It's been updated many times with many of my colleagues who are still in Annapolis. And so I really appreciate their dedication and support. Grace's Law back in 2013 made it a misdemeanor to repeatedly bully someone via the phone or internet. And there have been so many things like restorative justice practices and trauma-informed approaches through the Kerwin Blueprint that continue these efforts to make sure that we're stomping out bullying. Project Interrupt, that's with our Montgomery County Public Schools. Another one that's a training program for staff, students, and community members to make sure they're responding to bias and hate incidents. And oh, by the way, if we don't acknowledge what we just saw happening between Einstein and Sherwood High School as a prime example of how bullying can get out of control and have absolutely deleterious effects on a student and on the greater community. And so it's important for us to make sure that we don't forget about why it's not sticks and stones any longer. We know what happens with the pervasive abuse that sometimes goes on many of these social media sites and sometimes, unfortunately, in our schools. And we've got to do a better job as parents, as community members, as teachers and administrators, and as people to make sure that we're treating each other with dignity and respect. That is something that's at the forefront, regardless of our differences. The reality is that at the end of the day, we're still all human beings. And if we treated people as such, understanding that we may have differences of opinion, I think we'd be a much better place for so many more people. So with that, I really want to turn it over to our state's attorney, who does great work at the Family Justice Center with its Stop the Bully Montgomery workshops and is doing some great things in the community and continuing to make sure that we're addressing bullying. Mr. McCarthy.
Thank you very much, Councilman Rice. First of all, I want to commend Craig for his leadership, both as a state legislator and as a county councilman against bullying that helps promote student well-being. I know that I'm joined here today by the council president, Mr. Hucker, Councilman Katz, and Albernas, three other individuals that I know that are equally devoted to that same purpose. Preventing bullying and the pain that suicides that it sometimes causes is vital to public safety. My staff in the last 5 years has presented over 300 presentations about cyberbullying, internet safety, reaching more than 15,000 students in Montgomery County schools. Now, the majority of those students are middle school students, and we focus on middle school students because research seems to tell us that bullying peaks in those years. When I became state's attorney in 2006, the first program I started was Internet Safety Program with Montgomery County Schools that addresses this issue and all of the other related issues about misuse of the internet. Social media has made bullying even more common. When you do research and ask kids, is it easier to bully when you can do it anonymously? 81% say it is. They do things online that would not do if they were face to face with another individual. Look, now, in addition to cyberbullying, there are many risks to the internet: sexual predators, sexting, posting racist and offensive postings. Do we have to go any further than yesterday's headlines to see that not only, I think Councilman Rice alluded to this, not only does this affect our young people, we have a man who made $100 million as a head coach of the NFL football team who lost his job over this. Posting on the internet can have consequences. Also, as noted by Craig, Maryland has some of the strongest laws against bullying, stronger than most states. Sadly, the internet safety law, Grace's law that Councilman Rice referred to, came about because a young girl, 15 years old, took her own life after being bullied by other members of her high school class. It is illegal to cyberbully a minor in Maryland. I'm committed to helping students succeed, not only with our educational programs. Look, it's prevention, not prosecution. It's prevention, not prosecution. What we do with this cyberbullying program, as well as our truancy program, which I know every one of the council members that I'm speaking to today supports completely. These are important programs to help keep our kids safe and to prevent illegal activity. Look, I look forward to working with each member of the county council on these crucial issues to prevent young people from making bad decisions that will result in long-term consequences that will have effect on their educational and professional goals. Again, I want to thank Councilman Rice for inviting me here today, and I'm honored to join all the other members of the council as we have this proclamation, which I think is vitally important to the health of our community. Thank you, Councilman Rice, for inviting me.
Thank you so much, State's Attorney McCarthy. Councilmember Katz, did you have anything that you wanted to add as Chair of Public Safety, sir?
No, thank you. It certainly has been said by both of you in an extremely fine fashion. Bullying is never acceptable. It never has been acceptable. We've made it easier because of the internet, as both of you have mentioned, because of the cyberbullying, and we still have to remind each other it's our children, and in some cases, especially with in the cyber world, it's not just children who bully. It's people who are of age to be an adult, but they don't always act like an adult, and we need to make certain that we remind people that it's not acceptable. And I was told years ago that somebody who was concerned about being intimidated by a gang, and bullying sometimes can be that as well. They said, you have to understand that the people outside the gang, the gang has a finite number, but the people outside that gang are infinite in many cases. And that's who we need to be listening to, not the people who are attempting to belittle and to make themselves feel better, which really what they are doing is making themselves look worse. So anyhow, thank you all. Thank you, Mr. McCarthy, for all that you do. I know that you've had programs along the way. And of course, my colleague, Councilmember Rice, I know that you, certainly among all people, all of us in Montgomery County, have worked very, very closely with all people, being young and old, to stop this foolishness. So thank you very much.
Thank you very much, Mr. President. Did you have something you wanted to add as well, sir?
Just to thank you both for your leadership on this, and the chairman as well. This is a critical issue. It's affected so many people I know personally, and we aren't where we need to be yet. So we need to keep holding events like this and keep reminding people how important this is, because I think it's something that a lot of people either aren't aware of or don't like to talk about. But it's a real threat to our young people, and I'm very glad and grateful that you're bringing it up today.
Well, thank you very much to my colleagues, and thank you, State's Attorney McCarthy. I'm going to go ahead and start the proclamation. Whereas October is recognized as National Bullying Prevention Month, when we recognize the devastating consequences of bullying, which impacts 1 in 4 children in the United States and can often result in physical, emotional, and learning impacts on those who are targets of bullying, as well as the increased risk of engaging in more serious violent behavior by those who bully. And whereas bullying is any type of physical, verbal, emotional harm or intimidation directed at an individual or a group of people that can occur anywhere, including in our neighborhoods, schools, playgrounds, workplaces, and through technology, such as the internet and our cell phones. And whereas bullying can have enduring impacts on the emotional, mental, and physical health of victims, leading to long-term academic challenges, increased anxiety and depression, difficulty maintaining friendships or relationships, and self-destructive behavior. And whereas it will take a concerted effort from all members of our community to stomp out bullying by modeling kindness and respect, by building positive climates at school and in our workplaces, advancing social and emotional learning, and nurturing humanity and empathy in all of our residents. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby recognizes the month of October as National Bullying Prevention Month, and be it further resolved that the County Council encourages students, parents, and all residents to connect, empower, and engage in activities that promote bullying awareness and prevention strategies, presented on this 12th day of October in the year 2021, signed by myself and the Council President. Thank you so much, Mr. President. Thank you, Mr. McCarthy, and thank you, Chair Katz.
Thank you both so much. We're a little bit ahead of schedule, so I think we should probably pause for about 15, 20 minutes and resume general business at 9:35 to allow our guests to join us on time. Thank you all. Welcome back, colleagues. Madam Clerk, please share any announcements, agenda changes, or petitions that you have.
Good morning, Mr. President, council members. There are no agenda or calendar changes, and the council has not received any petitions.
Terrific. Okay, thank you. I didn't think that would take 5 minutes. Now we can sit as the Board of Health. Our guests with us, Dr. Stoddard, great. Welcome. Mr. Deandra, Mr. Blinsky, terrific. Dr. Bridgers, welcome.
Good morning.
Great shirt today.
Good morning. Thank you. It is Breast Cancer Awareness Month.
Ah, you're always right on time. Okay, good. All right, so Dr. Stoddard, are you leading this?
Bridges will go first, give the normal public health update. Then we'll
okay. Now the council will sit as the Board of Health, and we'll have a briefing on the coronavirus and our response by our Department of Health and Human Services, as well as the Montgomery County Public Schools. Welcome, everybody. Thank you so much for joining us. We're eager to jump in. Dr. Stoddard, the floor is yours.
Good morning. I'll actually turn it right over to Department of Health and Human Services, give our normal COVID briefing, and then we'll transition into the partnership we have with Montgomery County Public Schools to talk about what's happening there with testing and ultimately address the 5 to 11-year-old vaccination planning. So Dr. Bridges, I'll let you go ahead.
Good morning, and thanks again, Dr. Stoddard. Good morning, Council President Hucker et al. Happy to provide a update, but a couple of items I'd like to present to the council sitting as the Board of Health as follow-up to our last Board of Health clinic. We've made significant strides in planning for our flu clinic, so I just wanted to graphically demonstrate where those clinics are. Then I'd like to talk a little bit about Cancer Awareness Month, share some updates regarding that, then give an indication of the great work that we've been doing vaccinating our pregnant women population in the community. You know, the CDC recently sent out information and notice and recommended and strongly encouraged our pregnant and pregnant population women to get vaccinated. And so we have some county level data that really speaks to the great work that we continue to do with our vaccination strategy. And then Dr. Chris Snitchler, who is our resident internist and preventative medicine doc from our Uniformed Services Hospital. I've asked him to do some research into our case rates regarding pediatric data as we continue to plan for our pediatric vaccination rollout in those school-age kids who are between 5 to 11-year-old, and some of the reasons why in his data he will present as to why we have not seen those high level of hospitalizations for those multi-system inflammatory disease or those respiratory illnesses that some of the neighboring hospital partners experience. And then Mr. O'Donnell will present and give us a rundown on our COVID update, where we are, outbreak information, as well as our pediatric planning. And so again, so we've updated our Montgomery County Department of Health and Human Service flu clinics for our HHS, DHS employees, Dennis Avenue, our 1401 Rockville Pike, our 401 Hungerford Drive. And we've also identified those flu clinics for the community, as previously mentioned during the last Board of Health, at our university at Shady Grove campus, our Dennis Avenue Health Center, which will have a mobile clinic supported by Kaiser Health. And then our community clinics that will be supported by MCPS at our 3 high schools, Kennedy High Schools, Rockville High School, and Seneca Valley High School. I encourage all to get flu shot if you're eligible, as well as those indicators based on the data analysis from our EPI team, which indicated that deaths from flu and influenza and pneumonia was the 7th leading cause in Montgomery County between 2017 and 2019. That information is forthcoming in our local community health needs assessment that we are reviewing and will publish and share with the community and council and executive leadership as well. Again, it's Breast Cancer Awareness Month, but I also encourage all to get screened for those breast cancer, colorectal, prostate, cervical, lung, and endometrial cancers recommended by the American Cancer Society. It is fortunate that my father, who suffered from bladder cancer, had yet another screening yesterday. Unfortunately, they found some carcinoma cells in his sample, but the key is early detection and follow-up. So I encourage all to seek those annual or elected screenings based on your age appropriateness. Early detection is the key. Lastly, we've done extensive work through our maternity partnership program, where we vaccinated those expected mothers at our Silver Spring Area Health Center and our Up County Health Center. And I am pleased to say that our data is significant and presents a great rate among our Latina and African-American population, which we've seen and administered vaccinations. Since July, we've administered over 200 vaccines, complete series, to our pregnant population for these women who participate in these programs. About 22%, based on our estimate, which is above the CDC's vaccine safety data link analysis that our EPI team and our maternal and child health team reported to me as of last week. CDC is reporting that as of May, 16.3% of pregnant women were identified through their data analysis. And through our data analysis, we reported that 22%, which is higher than what the CDC has reported as of May and July respectively. And so we continue to encourage those unvaccinated pregnant women to get vaccinated to not only protect themselves, but their unborn child. We continue to provide information and also work with our child care providers as part of our communication and messaging to get those licensed and unlicensed healthcare, those child care providers to get vaccinated. And so we continue to make a concerted effort in this population as we continue to plan and prepare for our upcoming 5 to 11-year-old vaccinations. So I'll pause now and I'll ask Dr. Schnitzler if he would turn his camera on and if he has access to his PowerPoint presentation to present his data to council now sitting as the Board of Health.
Good morning. All right, good morning. Thank you, Dr. Bridgers. As Dr. Bridgers mentioned, I'm a Navy physician and internist, and I'm currently doing a second residency in public health and preventive medicine. And along with that, I'm doing a 2-month rotation with the Montgomery County Public Health Department. And one of the projects that I've been working on over the last several weeks there is basically looking at pediatric cases and data on COVID-19 in Montgomery County. So this, just as a military member who's presenting outside of the military, this is kind of a standard disclaimer that what I'm going to present is my own work, doesn't represent my university, the Navy, DoD, or US government. One of the biggest reasons that that pediatric COVID-19 is a hot topic right now is largely because of the potential for vaccine availability coming down the pipeline for the younger kids, the 5 to 11-year-old age group. And just as a quick review, I'm sure you know this, Pfizer vaccine specifically is currently available for those 12 and over. After the 12 to 16-year-old age group was added, was given an emergency use authorization in May of this year. And then last week, Pfizer submitted a new request for an EUA for children 5 to 11. And this was based on their data showing, looking at just over 2,000 kids that in this age group that were given a low dose of the vaccine, and they showed comparable antibody response to that lower dose. The FDA is likely to meet later this month to determine EUA recommendations for this younger age group. So before I present Montgomery County data, just for reference, this is nationwide CDC data based on age groups. Important things to see here. This is a busy slide, I apologize for that, but the trend that we see is that in the most recent wave, the 65 and older age groups were not affected nearly as much as previously in the pandemic, whereas those 5 to 15 proportionally had a higher incidence during this most recent wave. So for Montgomery County, here we see incidence of COVID-19 over the course of the calendar year in Montgomery County. And just to note that age grouping here is different than the CDC data I just showed. So it's, you can't really compare the actual direct incidence numbers very well, but mainly just to look at a trend. But the trends generally look similar to the US population. It's also worth noting that the younger age group here, which is 5 to 9, was higher than the 10 to 14 age group during the most recent wave, although not dramatically so. This slide is showing proportionally, so the proportion of all confirmed COVID-19 cases that each age group made up, focusing on pediatrics. You can see that during the most recent wave, starting in July, the 5 to 11 group made up a higher proportion of total cases compared to prior in the pandemic and compared to other pediatric age groups. And this is generally in keeping with trends in the national population. It's not necessarily a bad thing, likely at least partially explained by the lower incidence in higher risk groups and even the younger pediatric groups who have been vaccinated. But it does support the idea, though, that focusing on this younger group is now important for pandemic response. And then just to show you, something else that we keep an eye on, an issue that's particularly important to the health department is assessing for health disparities. And we keep track of COVID-19 incidents stratified by race and ethnicity. In general, earlier in the pandemic, there were larger differences between groups. In particular, Hispanic children had quite higher incidence than other groups. But in the most recent wave, you can see that the differences are still there, but much less pronounced than had been earlier on. And then finally, this is looking at showing the fairly low rates of hospitalization of children in Montgomery County with COVID-19. Overall, for the whole pandemic, 1.1% of kids with COVID-19 have been hospitalized, and then a month-to-month range of 0.0 to 1.8%. That's the end of my data. Here's my references. This second one, if anyone's ever interested, the American Academy of Pediatrics has a really good chart that kind of fills in some of the gaps that sometimes you're not able to see with CDC data. So it's kind of a nice reference to have for looking at what's happening with kids.
Thank you, Dr. Snitchler. Just to add to Dr. Snitchler's comments, we have used and included most of the information or much of the information that our uniformed services university residents have provided over the past 20 months regarding our surveillance and epidemiology data. It has been very useful as we look at our targets, as we determine the rate of incidence, as we consider transmission mitigation strategies. So thank you again for your work and our discussions. Now I ask Mr. O'Donnell if you would put up the pulse report and do the run of the pulse report today, focusing on our vaccine strategy for our pediatric 5 to 11-year-olds. And questions were raised yesterday regarding our data and our data analysis and use of CDC data that correlates with much of what the Maryland Department of Health sends us as their vaccine summary. And so I asked you to include some of the notes that we've received from our outbreak team and our epi team in your discussion.
Okay, thank you very much, Dr. Bridgers. Well, to start with the snapshot of where we are today, we have seen over the last 7 days, 662 cases. Our case rate is at just a little bit over 70 cases per 100,000 for the last 7 days. And our test positivity rate over the last 7 days is 1.83. I know a lot of people are interested in what that means for county protective measures, including the mask mandates. As you can see on the right, the state has a slightly different definition of transmission rates. By the state's definition, we have dipped below 10 cases per 100,000 per day. And that puts us in the state's moderate category. But the county mandates are linked to the CDC's transmission rates. And the CDC's substantial transmission rate includes case rates that are between 50 and 99.9 new cases per 100,000 over 7 days. We're currently with that 70 case per 100,000, still in that substantial transmission, although it has been trending down. The other part of that definition is a positivity rate between 5 and 8%. We're clearly much lower than that, but the CDC does use the higher of the two measures to define your community transmission rate. So I'll continue on. I know there are some of these questions that we'll address as we go through with relation to vaccination rates. So again, there's not been a huge change in vaccination rates. We continue to inch forward. We're now at 99.1% of our eligible county residents 12 and over having at least one dose, and 90% showing that they're fully vaccinated. These are based on the CDC numbers. There is a difference between the CDC and Immunet numbers. As we've shared previously, Immunet is linked to records that originate in the state of Maryland. It's the Maryland system for tracking immunizations. Because we are a county that borders the District of Columbia and the Commonwealth of Virginia, there have been a number of individuals who have gone to those locations as well as other places outside the state of Maryland to be vaccinated. The CDC's rates track the county of residence as much as possible. Not every state tracks that county of residence, but in Maryland, there is a required field for every vaccination that's done through the state vaccination electronic health record, that's PrepMod, that does track the county of residence. So there is a possibility I'll raise that the denominator in calculating these, which is the estimation of county residents based on census data, that certainly changes over time, and that can affect what those rates are. So it is, from the CDC's own admission, it is possible that, some of these rates they're based on estimations of populations, and sometimes they can be affected by that. But we do use that CDC data because it is based on the county of residence, not the number of people who are vaccinated in a given jurisdiction, but where they self-report they reside. Again, this is from the Pulse report from last Wednesday. We do expect to have updates very soon to the next Pulse report, but we have shown that our vaccination rates amongst our ethnicities and racial populations have closed as they have for the last several weeks. Our Black and African American populations are within 1% of our white non-Hispanic populations in vaccination rates. And our Hispanic Latino populations and our Asian and Pacific Islanders continue to excel at vaccination rates. These numbers, again, on the y-axis are depressed a little bit because, again, they don't include populations that either didn't report their racial or ethnic background or were vaccinated outside of Montgomery County. But as we are encouraged to look at this as a relative rate of where we're doing. Again, with a 99% at least single vaccination rate and 90% fully vaccinated, we are seeing convergence of all of our groups as they're getting vaccinated. So we have mentioned that we've seen this in the past, and this continues despite having converging totals for vaccination rates amongst our ethnicities. We are still seeing some discordance in the makeup of individuals who are becoming cases and who are hospitalized, and that is still disproportionately higher rates with our Black non-Hispanic populations. We still have concern over that, and we're still encouraging all of our populations, if they have not gotten their first or second dose, to get those. That is showing to be the greatest protection from becoming a case or being hospitalized. We also have looked at our case rates and hospitalization rates according to age. We do see higher rates at our younger populations. Our 0 to 9, 10 to 19, and 20 to 29 have the highest rates, perhaps not surprisingly for those younger ages as they're not vaccinated yet. Encouragingly, they do represent also, though, lower examples of severe illness at lower hospitalization rates. Where we see those hospitalization rates increase is with our seniors. And this is, again, why booster shots are highly encouraged for those individuals who fall into those categories. And they've been made available for Pfizer, and we're hoping they'll be available for Moderna and J&J very soon. There was a question at yesterday's meeting about whether we were seeing those hospitalizations in the seniors be linked to specific outbreaks or types of living facilities. We spoke with our disease control partners, and they have not seen an increase in outbreaks at our senior facilities, our assisted living facilities, and they have not seen an increase in hospitalizations linked to the outbreaks that do occur. So we think that this is fairly equally spread throughout that population. We do encourage all of those individuals again to get boosters when there's an eligible vaccine for them. So if they had Pfizer, that is currently now, and hopefully again for the other vaccines very, very soon. To the point of why we're continuing to recommend that 10% of the population who is not fully vaccinated to continue to come out and get their vaccine, we're seeing that they still make up more than half of our cases and more than 65% of our hospitalizations. So again, they're at a higher risk for obtaining COVID and at a higher risk for having a severe outcome. So we're still emphasizing that we'd like to get everyone fully vaccinated. Just to go into where we are with boosters, as we know that the FDA will meet on October 14th and October 15th, so later this week, to discuss boosters for the other two vaccines. We are hoping they will provide guidance on approval for them, and that the CDC and the ACIP teams will provide guidance on how to administer those. We hope that will happen extremely soon so we can get more people in to get booster shots. As has been already brought up, the pediatric vaccination updates, Pfizer has submitted their safety data, and they are scheduled to meet on FDA is scheduled to meet on October 26th to review the data. We now know that the CDC and ACIP will be meeting November 2nd and 3rd to give their review, and if it's authorized by FDA, to review their consideration for authorization and their directions for administration. So that gives us a little bit finer timetable on when we might have these vaccines authorized for the pediatric populations. Following that, we know that Pfizer is currently manufacturing their pediatric doses, and there'll be a distribution of that supply out to public health and community providers. There's been a lot of planning going on with our partners within HHS, within MCPS, and lots of public and private partners across the county. As we prepare for this pediatric rollout, the county is already working on expanding capacity and hours for both boosters and pediatric doses. Over the past 2 weeks, we've moved to larger facilities in Montgomery County, Montgomery College Germantown campus, the East County Recreation Center, and the Silver Spring Civic Building. We're continuing to increase the number of clinical staff we have on board to give these vaccines, and we'll be looking at, as we move into the pediatric populations, updating our hours of availability to better align with parents and kids being able to be available to get vaccines. We've also been talking with our school partners about potential sites, and what we do is we continuously monitor where vaccination rates are going on in the county, and share those with our partners. And as we move through this rollout, we'll be able to evaluate where we need to have clinics in the county, again, to make vaccine more accessible. We have some ideas based on the 12 to 15-year-old rollout of how that will likely play out. But again, we have real-time data on a daily basis to update this, and we'll certainly make sure that vaccine is available where our populations need them. We're also coordinating with our transportation partners to work on additional resources, both public and private, that can get people to vaccination sites, people who don't have their own transportation. And we always look at vaccination clinics that are highly accessible to public transportation resources. We have been coordinating with our pediatric practices to ensure that they can give vaccines. The CDC has reported that more than 70% of vaccine for children providers have already enrolled in receiving COVID vaccines. We've seen, looking at local data, we've seen that play out here in the county, not only for pediatricians, family practices, and other types of providers. So we're going to ensure that they are part of the group asking for vaccine. We know a lot of people rely on their pediatricians for care for their younger children. We have heard some talk at the national level about potentially there being an allocation for the first delivery of vaccine. We don't have any specific data about it, but I do want to let the council know that the county is committed to ensuring that all of our partners who reach all the different populations in our county have access to vaccine early on and then throughout the process. So if there does happen to be an allocation, we'll work with those partners as we have throughout this process to make sure they have access to vaccine. We're also coordinating communications and outreach with our public and private schools. We've seen during the 12 to 15 rollout that those communication networks that our schools have with parents was a huge factor in encouraging people and families to come out, not only of the students, but of their family members as well. We've been meeting with the COVID operational advisory team and working with those partners throughout the community to identify strategies and partnerships that can help increase accessibility to vaccine. We do expect a significant demand over the initial few weeks. That would be completely consistent with the 12 to 15 rollout and consistent with our county's appetite for vaccine. And so we're making an emphasis to have as much access and move as much vaccine early on as we can, anticipating that there will be a high number of people looking for vaccine. That was the data I have on there. Again, we'll be happy to answer any questions that you all may have.
Thank you, Mr. O'Donnell. One point that I would like to share with council this morning. Sean, can you stop sharing your screen, please? Thank you, sir. And so one key point that I wanted to share with council this morning, as Mr. O'Donnell indicated, we continue to administer those third shots for those immunocompromised individuals who are eligible to receive a third shot of the Pfizer and the Moderna series vaccine, as well as those individuals who are eligible for the Pfizer vaccine to receive the booster shots. This is an indication of data that we received yesterday regarding county level data. We've administered 35,857 additional doses throughout the 215 spaces that I spoke of the last time council said as a Board of Health. In our 3 static sites, we've administered 2,151 sites. So similarly, it's indicative of all of those spaces, all of those partners who have been instrumental in us administering the doses, which can be attributed to our high vaccination rates. So I just wanted to share this as an indication. These data also include those individuals who have contacted the local health department, who are homebound and who are eligible to receive an additional third shot or a booster. We have been supporting that effort as well. Dr. Stoddard.
Yeah, so a couple things I want to highlight about what we provided today. So obviously, as Mr. O'Donnell alluded to, with the J&J and Moderna reviews occurring later this week and likely being acted on by next week, we'll have about a 3-week window between when those boosters are likely to be approved and when the children 5 to 11 will be vaccinated. If you fall in the categories that are ultimately approved for the J&J or Moderna booster, I would certainly highly encourage you to try and get that booster in that 3-week period, because we do know that the clinics for our 5 to 11-year-olds will be extremely busy when those open up. And so it will be much more difficult to schedule appointments in certain county clinics. Pediatricians obviously will cover a lot of it, but I just want to give people a heads up to think about pre-planning when you're going to get your booster. If you're eligible, the first 3 weeks will be a lot more easy to access sites before the surge comes in from the 5 to 11-year-olds certainly to the county sites. And so we'll offer some divergent opportunities to cover both those pools, but obviously the first 3 weeks you'll be the only game in town, as it were. So we certainly encourage you to get your vaccine then. We can proceed into our discussion with MCPS now, Council President Hucker, or we can take questions on what's been provided so far and separate them out. So, whatever your pleasure.
I got a couple colleagues in the queue. Councilmember Reamer, is your question about HHS or MCPS?
I'd be happy to wait for MCPS's presentation. Yeah, thanks.
Councilmember Katz?
I just want to, and Dr. Stoddard just mentioned it again. I thought that I had actually understood the boosters for Moderna because I received Moderna through the county, and then I got confused as to whether I could get a booster for Moderna through the county. Can I very clearly, Dr. Stoddard, can I go and get a Moderna booster right now because I'm eligible because of my age. I'm not immunocompromised. So what is the answer on that, please?
So Moderna boosters are only approved at this point for immunocompromised individuals.
Mhm.
The review that will occur later this week will presumably identify, my sense of this is, and this is Dr. Stoddard prognosticating, which is always a dangerous proposition.
I'll ask you what the number's going to be tomorrow too.
Exactly.
Yeah.
I would guess they're likely to approve a similar scheme to what was approved for the Pfizer vaccine for Moderna for older adults as well as those in high risk jobs. Just reading the tea leaves, I think they're likely to be a very similar pattern to what was approved for the Pfizer vaccine. But that will not occur until next week for those. So immunocompromised, yes, now you can get one right now. Age and occupation have to wait and probably until, my guess is end of next week.
All right, and when it is available, then we should get an appointment, or should we just go there? How does that work?
So the county, I'll let Dr. Bridgers chime in on this. So obviously there'll be a number of opportunities where you can get vaccinated. You can get vaccinated through typically your primary care provider will have it. Pharmacies, grocery store pharmacies. The county will obviously be operating clinics. They'll have vaccine there available. And depending on the opportunity, you either will want to make an appointment or you'll be able to walk up. It'll just vary by appointment. So for the county sites, I'll let Dr. Bridgers talk about what we're doing right now in terms of, I think many of them will walk up, but I want to make sure that I'm accurate on saying that.
Sure. Thank you, Dr. Stoddard. And I see Mr. O'Donnell has his hand emphatically raised, but it is just that we are welcoming walk-up appointments, but we strongly encourage appointments for not only to ensure that we have ample supply of vaccines at our particular site based on the series of doses, but also to make sure that we don't have the extended lines, the crowds, etc. So walk-in Councilmember Katz walk-up appointments will be honored. However, we ask for individuals to go online and schedule an appointment. On our website, we also have, I believe, and I haven't pulled it up this morning, those categories for those individuals who are eligible to receive either a third shot for immunocompromised individuals, as Dr. Stoddard indicated, for the Pfizer series and for the Moderna series, as well as those individuals who are eligible to receive 18 years and older who are eligible to see the Pfizer series booster. So therein is the distinction. Mr. O'Donnell?
Yes, I just wanted to add to that. There may be a slight distinction between the third dose of Moderna for immunocompromised and a booster shot for Moderna for everyone else. Mm-hmm. And that is that Moderna has submitted to the FDA that their booster dosage would be half of the full dosage. The immunocompromised third dose is a full dose of Moderna, and the booster may be a half dose. We'll see when the FDA reviews it and the CDC reviews it. So there may be a slight difference between those two things. And again, the reason we would encourage appointments is now with so many sites that have vaccine, certainly we would hope that people don't have to wait in line to get that vaccine. So we encourage it, but we will allow people to walk up at our sites.
And also, my last question, Mr. President, on the flu clinics, does a person need for the county flu clinics, does a person need an appointment for that?
No, we're accepting walk-ups regarding that. Although, again, Councilmember Katz, there is a information portal online that has appointments. The key for having appointments is to manage the crowds, long lines, and to limit any wait time. So we are, again, honoring appointments and walk-ups, et cetera.
Thank you very much, Mr. President. I thank you and I turn it back to you.
Thank you. Let me, I'm trying to bifurcate my questions too, to allow HHS to respond to any fresh questions before we move on to MCPS. You all, and sorry if you've addressed this, I'm getting barraged with texts this morning, but I was going to ask how you're working together to plan and implement the rollout for 5 to 11-year-olds, and you explained that in your partnership with community organizations. You may have said this, but is there a target for getting a certain percentage of 5 to 11-year-olds vaccinated within the first month or weeks?
What I'll say is, I expect because I expect a high number of people to come out in the first week. I'd like the county to be able to, the county and private providers to be able to vaccinate 25 to 30% each of the first 2 weeks. I think we can expect to see that many come out. And that's what we're working towards, a capacity that would get us there. The state has shared with its local partners their estimations of capacity, and their estimation is that we can do that. I believe that their estimation is under what we can actually do based on history and the direction we're going. So
they underestimate you. Good. Okay. So 25 to 30% within the first few weeks. Is that, what's a few? 3 weeks?
Well, I'm hoping that we can do 25 to 30% each week over the first few weeks to meet that demand. Based
25 to 30% of the eligible 5 to 11-year-olds each week. So that'll be a shrinking number, but a consistent percentage.
Right. What we saw
great.
was a huge percentage of people came out in the first week on the 12 to 15-year-olds, and then it slowly trailed off. And that was not only Montgomery County, that actually was the whole state that had a very similar response. So I think we can expect to see that.
This is a welcome amount of specificity. That's terrific. Thank you.
I would only, Council President, one point I would rate. So we talked about this a little bit, but I want to make sure the public understands this. So the new doses of Pfizer that are targeted for the for young people will come in a new bottle with new labeling, et cetera. So it'll be every dose that we have of Pfizer before will not be, what we're being told is not going to be usable for younger people currently.
Not
so
usable for
the younger population. So the current adult dosing bottles material that we have will be distinct from what we are provided for the 5 to 11-year-olds. So it will, and obviously our goal in every case is when we're given an allotment to get that allotment out the door as fast as possible. But it is in some ways incumbent upon what the federal government provides to the state and what the state then provides to us. So I think we're planning for 25 to 30% per week, as Mr. O'Donnell said, but I want to make sure that we understand that because we won't be able to use any of the existing supply of Pfizer that we or the state currently has, it will be dependent on how much of that new labeled Pfizer vaccine that is provided to us by the federal government.
And Council President Hucker, just to add to that, when you reference or Mr. O'Donnell's reference to extensive conversations with our community partners, we have had extensive conversations with our community partners regarding their capacity to receive doses directly by establishing an identification number in Immunet so that they can get doses directly sent to them, as opposed to in previous incidences or cases where we've had to transfer doses to them to support their vaccination efforts. This will make significant strides in our safety net clinics, where we know the community, they are trusted agents to the community. Also, just to add to that, conversations have been extensively and ongoing with our MCPS and our private school partners regarding those accessible points. Mr. O'Donnell mentioned an equity framework. An equity framework is at the center of our planning, and it is essential to us effectively getting these shots in those 5 to 11-year-olds, and we continue to look at that. Lastly, the Maryland Department of Health, I will be sitting in a meeting tomorrow with the other health officers. The guidance is scheduled to be sent to Governor Hogan by this weekend, a draft guidance. We don't know what that guidance will look like. if it will be a similar variance of doses and allocations sent to those jurisdictions based on their population. So we're planning for that, as well as the contingency to make sure that we get those doses on Monday or Tuesday. We're able to begin our vaccinations upon receipt. And so that's part of the planning process and provides a little more detail with part of our plans.
You're still not getting any insight from MDH or the governor's staff about what the draft guidance is?
Not yet. It's scheduled, to my understanding, to be sent. The Maryland Department of Health is scheduled to send their vaccination guidance for providers to the governor by Friday.
Well, I mean, you used to be the health officer for Calvert County and you have contacts all over the state. Are your colleagues in other states, in other counties, getting the draft guidance?
Nobody has the guidance yet. That's what we will be talking about tomorrow at the health officers roundtable regarding the guidance for that. And so once I know, then I will share it with our county officials. However, that guidance will be, and Dr. Stoddard and Mr. O'Donnell had this conversation last week, I believe, whether or not it will be population-based, whether or not the vaccines will be, there's some indication that a majority or bulk of the vaccines will be sent to provider clinics, and we don't know yet. So rather than generalize or say we are not waiting for the guidance, but we are planning for multiple contingencies based on the guidance. So once we receive the vaccines, we will be ready to deploy the vaccines in that population.
Okay. I ask, of course, because earlier during the pandemic, of course, we were not receiving the same information from the governor's office. It was being withheld from us, but not from other large counties.
Right.
I think, got to 50% of our 12 to 15-year-olds within the first 10 days or so. Mm-hmm. So you're predicting a lower percentage than that, but you'll catch up within the first couple weeks or so.
This is a much bigger population too. I think that's important to recognize. So
5 to 11, yes.
Yeah, 5 to 11 is 105,000. I think it was about 60,000. So we did about the same 25 to 30,000 doses in the first week for the older population. It's just a bigger percentage of that total population.
Is there any prediction on how long it will take the governor to approve the draft guidance?
No, I'm not sure, but absent of having the guidance, whenever it's approved, we will be ready to administer the vaccines as we've done before with the third shots and most recently with the boosters. And so that's why we have had multiple conversations. We've also are in the process of querying the community to see whether or not individuals who are eligible, or if parents will take their children to provider clinics, pharmacies, hospitals, our local status sites, or other grocery stores, et cetera. So we are trying to gauge the community interest, and again, goes back to our extensive conversations. And we appreciate all of the support that we've received from all of our minority health initiative partners, our community partners, et cetera.
Thank you. Yes, we all appreciate their hard work greatly. My last question sounds like an education question, but don't be fooled. It's really to be addressed to HHS. I watched the Board of Ed meeting last week, as everyone should, and I was surprised to see something I hadn't seen in a very long time. The 3 MCPS unions, EA representing the teachers, MCAP representing principals, SEIU 500 representing really everyone else, before the Board of Education, and they have very different cohorts of membership, as you know, but they said one thing in common, which is that their instructional and their administrative staff is stretched to the limit, beyond the limit, because they're assigned now to conduct public health duties that they thought HHS was conducting, especially contact tracing, and that all the free time and planning time that they were counting on when they took the job is now being taken up doing contact tracing, which they thought is HHS's job. So I don't know whose job it is. I would that seems reasonable to me, but I wanted you to have the opportunity to address that, because it sounds, I mean, they say they're at the breaking point. They say we're going to lose teachers and other educators and administrative staff. They say they have stretched teams that were already understaffed and have lost educational time over the last 18 months, and they don't want to be spending their planning time and break time focused on contact tracing. I'm wondering if HHS has added the staffing necessary to relieve MCPS staff of those kind of duties. I guess that's the main question. Thank you.
Good morning,
So
President. Oh, I'm sorry.
Go ahead, Mr. DeAndrea.
Would it be okay for me to jump in?
Sure. I just thought I can wait to your section, but really has HHS responded to this need? Because I heard from your employees that they're doing HHS's work. Dr. Bridgers?
Sure.
We can come back to this too, but.
Sure, I'll chime in, but thank you, Mr. DeAndrea, for turning on your camera to show the collaborative effort that we've had. We've had multiple conversations, even over the weekend, looking at adding additional staff to not only help with our rapid testing model that has made significant strides to lessen our quarantine numbers in our MCPS school system. So we have begun to identify staff to support that effort, as well as future efforts with our test to stay model that Dr. Stoddard and I will be presenting to MDH hopefully today for their recommendation and consideration so that we can start to deploy that model. As a reminder to all, the test to stay model is a modified version of quarantine to keep those students who are asymptomatic in the classroom if they've had a close contact. And so that's a general summary of that model. But we continue to use that and add staff to support that. So we're looking at those schools that we've received and that we've been communicated by Ms. Glick, our school health administrator, and Mr. DeAndrea and his team as those schools that may have been stressed and have staffing. So we have those in the hopper to in waves or in groups, if you will, so that we can build up to the capacity to handle not only our testing, but also our contact tracing.
Right.
So that's the long answer. The short answer is yes.
Sorry, just to clarify, I think you said you were beginning to identify the staff, and then later you said you were continuing to add the staff. How many?
No, we've identified the staff. We've identified the staff. They've been onboarded in the first group. We deployed them yesterday to support those schools. So we continue to do
how many
in groups. I believe it was up to
17.
30.
It was 17 yesterday, 5 more tomorrow. I just talked to Ms. Glick.
Sorry, Dr. Stoddard, 17 yesterday and how many tomorrow?
5 more tomorrow and more coming on Thursday and Friday as well.
How many more Thursday and Friday?
I don't know.
Okay.
We had hoped to have 50 by the end of this week, but honestly, it was 24 we're supposed to start as of Sunday night. 17 show up at schools. This is a contracting agency where they're not our employees.
Yeah.
So we are dealing with that as a consequence. And
we continue to add to those numbers as they bring those staff in, we get on board, they go through the background investigations and we can deploy them in the schools.
Okay. Well, yeah, I wish we weren't in this position, but this will be a relief to our education staff, I'm sure.
Yeah, I would say.
Will they also be offering flu shots as well as vaccines?
Not at this time.
Is there a plan to move in that direction?
Well, we have our community level schools, and so I will follow up with our school-based health and wellness that would be the likely points to administer those flu shots.
Yeah, I want to, Council President, I want to say a few things here. Number one, we've been hemorrhaging school health staff for months. And we can't hire, we've obviously had open recruitment for more than that. And so it is incredibly difficult to hire clinical staff of any kind, CMAs, RNs, any of the kind.
Right.
And so,
I know you're going to move on to an important, I don't want to, because you've said that in other briefings, and I just don't want us to lose that point. What could we be doing to stop the hemorrhaging of losing school health staff? Because that's really a critical thing. I just don't want us to gloss over that.
We've got to conduct a study of the positions to allow us to frankly change the compensation model.
Do we do exit interviews?
What's that?
Do we do exit interviews?
I won't know the answer to that question. I could certainly find it out.
Is there a market survey of salaries and benefits?
That's what we're working on conducting right now. But honestly, this is hospitals are understaffed right now. We could talk about that as a whole separate issue. I'm sure we will. We've burned our healthcare system out over the last 20 months. Based on some really, bad policy decisions at the federal level over time, but also just, not dealing with this pandemic the way that we should have. And so we've just, eroded our healthcare system writ large, and we're experiencing that people getting out of nursing entirely, retiring early. Right. The nursing population is already typically skews older, and that's a pre-pandemic thing. And so many people are just getting out of the business altogether. And then obviously, then there's, certainly private sector can very quickly change their salary scales to allow for increased compensation to allow them to compete better.
And you can, right?
Yeah, then we can. So all those things. This is an issue we're going to have to deal with both for COVID-19 but beyond, frankly. And very interested in engaging with council on that.
The whole county government and MCPS are affected by what economists are calling the Great Resignation now following the recession. Council Member Friedson.
Thank you. I think we need to have a much longer, detailed, specific conversation just on that very point, because I think we could talk about it for a full briefing, and I don't think it's unique to Montgomery County. I don't want to, cast blame here, but it's a crisis, and it is a broad healthcare crisis and something that is devastating to the county, to the school system, to our kids, and we've got to figure out solutions about how to address it, given the fact that it's a really tough situation. But I won't harp on that, although I have a lot of follow-ups on that. Hopefully we can continue to have that conversation. Just wanted to a couple of follow-up questions, Dr. Stoddard. You'd mentioned the capacity and the change in the dosage. Several weeks ago, the thought process was we were going to repurpose, like a pharmacist does, repurpose the dosage. This dosage is 1/3. The smaller children dosage is expected to be 10% if it's ultimately approved, and you could just do a smaller dosage and we could handle that, appropriately with licensed professionals here in the health department and in clinics around the county and hospitals around the county. Today, you shared news that is not, in fact, what is going to work for us based on federal guidelines. They're going to have to be completely separate and labeled differently, presumably to protect against dosage mistakes and problems. But that does create a challenge for us, because one of the thought processes was the second that it got approved, we were sitting on, vaccine dosages in the health department and in, private healthcare providers throughout the county, and we could be ready to go as soon as the green light was offered. Now we have to wait for the doses. So I just wanted to clarify based on that, because I think it was a really important point that is new as of today for us, at least. Perhaps not for you. What's the expectation based off of that? If the meeting is expected to be, I believe, is November 2nd and 3rd, to perhaps get the approval, that would be the earliest that would come. How long would we expect then to get the doses and then actually be able to start getting the shots in arms for the 5 to 11-year-olds?
I think we all anticipate that it will come. If we'll have doses to us either at that point or even before that point, and they'll just be not approved for use until the authorization comes. What we've been told is that, I think Mr. O'Donnell was alluding to this, is that there may actually be an allocation that either the state has been given a heads up about. We certainly haven't heard about it, but I think the key that we're trying to understand is, and this is a really important point. So if they do a per capita distribution to Montgomery County, that would be inclusive of our presumably inclusive of our pediatricians and pharmacies. And so whatever allocation the county government would receive would be a subset, some portion of our per capita allotment, because the other portions of that per capita allotment will go to the direct pediatricians and other providers. And so obviously we are the social safety net for those people who don't have access to a pediatrician or who can't conveniently access one of those opportunities. So we're looking to set up things in advance of that. But we're hoping to find out the answer to your question about when it'll arrive before, and I don't know that we know it until the plan for the state has been approved.
So just to add, Dr. Stoddard, and thank you, Councilmember Friedson, for that. I'm looking at my notes that I printed out this morning from the local cadence call that the state has with all of its principal sections. And so they are anticipating that the vials will be, that the vaccines are expected to be 10 dose vials with 10 vials a pack. And so again, looking at their guidance, we don't know if it's population-based, if it will be based on what we've previously received. But we're planning for that. And as I indicated to Council President Hucker, we're looking at multiple contingencies so that we can get the shots out as soon as possible. With the previous guidance, we received our weekly allotments usually on Monday evenings or Tuesday mornings, and we began administering that. So upon receipt, we plan to be ready to administer those doses. But again, the variants we aren't aware of, we don't know, we're still waiting for those decisions. So however we receive it, we have those contingency operations in place. Lastly, one difference in our contingency planning that we did not have before, when we received the vaccines, we had to receive them and transfer them out. We've worked extensively this round in our planning processes from lessons learned to assess and query our pediatric as well as our safety net providers that Dr. Stoddard indicated to have access directly to Immunet so that they can get doses directly to them, which we hope will not subtract from the doses that we get from our community allotment. So that's part of our framework and planning. Just wanted to share that as part of what we have contingency, what part of our contingency planning for this round.
Well, it's obviously great news. We heard earlier 70% of providers for children have signed up already. So they'll be part of this effort. You've got the partnership that you're working on with community partners that you've built over the last 20 months. But we've got 2 or 3 weeks, and I think our county leadership needs to work together here and figure out how we talk to the state, talk to the governor, talk to our legislative leaders to make sure that we know exactly what we're going to get and when, so that we can be prepared for it. Because the 25 to 30% that was noted, which would be great, and I think is very doable based on the 50% in about 10 days, if I recall, and the council president noted that we did for, admittedly a smaller group, but that was because we had the doses. That's because the doses weren't different. So we were ready to go, and you have been saying, and we have been echoing the idea that if we have the doses, we can get shots into arms. And so we've got to have the doses in order to do that. We know that there's going to be significant demand based on the fact that we're the highest vaccinated jurisdiction in the country, for those over 300,000, highest in the region, highest in the state, but we need the doses to happen. So that's a carry on from this conversation as we move forward, and we got to do it now, because if we wait until the approval happens, it will be too late to prepare and to get the message out to residents of where they can go and how to do it. And I think the answer to the equity issues are making sure that our health department is that social safety net and can provide it and can work with community partners and can be in the most accessible places possible, but also that other people who have greater access can go to their doctor and won't be competing, so to speak, that everybody will have access in a way that makes sense for them and their family. That's how we get everybody to be safe and don't leave everybody behind. So let us know what we can do. We're all here to help and support, and I think we need to start having those conversations now beyond just the health department. I think it needs to be political conversations with elected and appointed officials as well. So please deploy us as you will. Just last question and comment. There's a lot of confusion related to the indoor mask mandate, the CDC guidelines, and what it's based off of. Not because of anything that the county has done, but largely because the CDC has frequently changed what their standards are, just in how they calculate the number. It used to be the number that people looked at based on 10. If we wanted to be below 10, we had gone above 10. That was an average over the course of 7 days. It's now changed, and now we want to be below 50. Which is a different calculation. But it's confusing for us. It is particularly confusing for residents, and I don't think that we have made this very clear in our public communications, and so I think we really need to improve that. I don't think we've made it clear in English. I think we certainly haven't made it clear in all the other languages that it has to be clear in, to make sure that every resident understands what the rules are and why we're doing that and how it's based on the CDC guidelines. We didn't make this stuff up. We're following the public health guidance at the federal level. But on the website, if you go to it, we do have the 2 key indicators that are the basis of our indoor mask mandate, the cases per 100,000 over the past 7 days, which is currently at 70.8%, and then the test positivity rate. But it doesn't explain why that matters. And I think that needs to be highlighted. It needs to be at the top. That is the only county-specific regulation that is in place, the indoor mask mandate. And so I think we can do some work to highlight that better. And even if you go down to the county surveillance with the different indicators, the Montgomery County reopening indicators, the language refers to past reopening standards and not to the indoor mask mandate where we are. So just wanted to note that if we could be much clearer, have something easy for all of us to point to. Obviously, most people don't go to our website, but it would at least be nice to be able to have a clear place on the website that explains this in clear upfront language for everybody to be using. And then we have to be much more proactive with that, what the rules are, why they are where they are, when we expect, where the trend lines are going and what they're based off of. Be much more proactive, make sure that it's in multiple languages so that we're reaching the diverse community that we have in the county. So it was a question in the form of a statement, or a statement in the form of a question, but I just wanted to note that, and I hope I have your commitment to work on that.
Yes, thank you, Councilmember Freets, and we will make sure we have the information regarding test positivity, case rate, what it means regarding community level transmission. When you look at the website and you see moderate community level transmission versus substantial community level transmission versus where we are moving from or have moved from, which was previously a high community level transmission rate. So our team will work on that to make it clear.
And the key is just very simple, very straightforward, very upfront and clear to see. If you have to scroll down half of a web page to find it, you're going to lose a lot of residents if you're lucky enough to have them visit the website in the first place. So thanks for your work on that. Appreciate all your efforts, and I'll yield back to you, Mr. President.
Thank you. Just while we're on the staffing crisis, you all have so many resources available to you. What are you doing, or are you sure you're doing everything we can to make sure everybody at the Welcome Back Center, the Latino Health Initiative, the African American Health Program, the Asian American Health Initiative, the state's Medical Reserve Corps, that all those individuals know that we have positions available today in HHS working with our students?
Yes, we've shared the healthcare human resource need with our community partners, as well as our minority health initiative partners. Going back to the previous comment at the beginning of the school year, we added 40 additional brokers to support our school health services and our school health room tech. We found out that just wasn't enough, as Dr. Starter indicated, to a high turnover and attrition rate. And so we continue to assess that and add. We've sent out multiple recruitment notices, as well as information on various job search engines. And so we are doing that, and we continue to do that, and we will advise you as more support is needed.
Great, thank you. Councilmember Novato.
Thank you, Mr. President, and thank you to the team that is assembled here today. I think that data point of having Montgomery County having 99.1% of eligible residents receive at least one dose is pretty extraordinary. And we need to really be grateful to our residents for constantly standing up, but also to our employees who worked so hard to get us here, and our community partners who have also worked collaboratively, employing extraordinary best practices. This is no joke. This is quite an accomplishment. So I think the credit needs to be extended, and I am really also very grateful to this body that has worked collaboratively with the administration in order to get us to this point. I also wanted to chime in a little bit on this issue of staffing, because under the leadership of Councilmember Rice and Councilmember Albornoz, we've had joint sessions of the HHS Committee and the Education and Culture Committee to discuss this issue. This is not new, which really speaks to the fact that we've been very fortunate that we have strengthened our capacity in so many particular areas. This has been a stubborn area. It's been real persistent. And as Dr. Sauter said and Dr. Bridgers, this pandemic really, really, truly has created a crisis. I mean, I have personally received texts from nurses that I know in a couple of hospitals who are at their breaking point because they are having now to work, much longer hours, and it's just so taxing. And then when we even talk about cultural proficiency, in language capacity, I mean, of course, it gets even worse. So I just wanted to, let my colleagues know that the Joint HHS and Education and Culture Committee have had conversations about this. That GO also has had conversations about this vis-a-vis what we can do with HR, et cetera. But there's no doubt that I think we need to put a pin on this issue in terms of coming together and being a lot more forceful. WorkSource Montgomery plays a role. The Welcome Back Center was mentioned. I mean, we do need to address the immediate crises, but then be much more strategic with growing our own and providing opportunities. So I just wanted to mention that because I think that there have been already some plans put in place, but there is no doubt that we cannot underestimate the fact that we are being affected in crisis mode, as you will, especially now with the advent of these additional vaccine efforts. It's going to be difficult. So anyway, I just wanted to mention that, just to flag that for everyone. And our own central staff, we have extraordinary analysts who have been helping us with this as well. So there's a lot of information on packets, et cetera, that will point to the conversations that we had, I think, as recently as like 2 weeks. Thank you.
Thank you, Councilmember Navarro. Just to add, I appreciate all the feedback for the support and the work that we do. We've also reviewed and looked at other jurisdictions in the area and what they're doing regarding their healthcare needs, as you indicate, is not only in our school health system, but also in the healthcare industry as a whole. We even had, if you've seen some early on, some of the indicators that even the health officers and administrators have sought other opportunities because of the burden that our response and moving into the recovery has seen. One other strategy that we've looked at, even with our rapid testing in our school system, and we've worked with state to follow up to get questions regarding all of the facets and the responses that we've done, but looking at having our community health workers who are trusted agents in the community and who've been significant in supporting our vaccination effort to be able to administer those rapid tests as well. So we move from having a dependency on clinical staff and having the clinical staff be able to do those things that they could do to respond to those school health needs of those students. And so in that regard, but again, at the end of the day, support is needed and we welcome the support.
Thank you for mentioning that. Sometimes we talk about the minority health initiatives as if they're like this general category, but it is important to remember that under the leadership of those initiatives, which were established a long time ago, we did launch some extraordinarily targeted COVID-19 initiatives that have partners like Care for Your Health, like Mary Center, like the African American Health Board. They have been on the ground. I mean, they are really the protagonists of this story in Montgomery County. And as you just mentioned, Dr. Bridgers, absolutely, because they're ready to step up once again to do this work. And we have built, I think, an extraordinary capacity already with, of course, the network of the hubs and things like that. So the Montgomery County story in this particular, arena, I think it's very comprehensive and very robust. But there is no doubt that we have to figure out, as the leaders, what do we need to do to strengthen that capacity, and that's what we will hope to hear from all of you is, do we need more funding here? What is at stake right away so that we can continue this story in this fashion? So I really do appreciate it. And I appreciate you mentioning how other folks, like health officers have sought other opportunities. Yes, that was the case here in Montgomery County, but, the burnout is real. The burnout is real. And I will close by saying that I am almost surprised how everyone just is trying to just continue as if it's business as usual, and it's not. because what our employees have faced and what our community partners have faced is just the sustained, trauma and just stress that cannot be underestimated. And I can only imagine, how this then has affected our healthcare practitioners. So all of that is really important to factor in this conversation because, we're not robots, like we're all human beings. This has been a really difficult time for everybody. Thank you.
Thank you. Council Vice President Albornoz.
Thank you. I want to defer to MCPS to present because they haven't had a chance to do that yet. I just wanted to mention quickly, we are working right now, and I appreciate Councilmember Novato's points about previous joint sessions we've had, which have been very productive. We are scheduling another one for the benefit of my colleagues and our public at home, because this does, as Councilmember Friedson and Council President Hucker mentioned, deserve a much deeper dive. This will be scheduled in November to discuss staffing challenges, but also policy crossover, as well as the position that MCPS announced through Dr. Monifa McKnight just a couple weeks ago about the public health officer position that they're going to be hiring, and specifically talking about the intersection with our public health team. That's all being worked out. I have a lot of confidence in the teams, but this will be an opportunity for us to ask questions publicly. It doesn't prevent us from asking them privately, but this will also be a chance for us to productively talk about next steps moving forward. So just wanted to highlight that. Stay tuned. We'll be the first or second week of November.
Great. Thank you. You were the last in the HHS queue. So Jimmy, thanks for your patience. The floor is yours.
Good morning, Council President Hucker and council members. Thank you very much for the opportunity to share again this morning. I do just want to start briefly by acknowledging that we have had a very positive and collaborative working relationship with DHHS and really appreciate all that they're doing to support our schools and ultimately being able to make sure that our schools can remain open at 100% capacity. In terms of the comments that were shared at the Board of Education meeting by the presidents of our 3 employee associations, they definitely make some very valid points about the challenges that school staff are experiencing, because we know that bringing all of our students back into school buildings after many had been completely virtual for almost 18 months presents a variety of challenges. And so there are a lot of different pieces that were alluded to in the information that they shared. And I know we don't have time to go into details now, but I do just want to highlight that while contact tracing was one thing that was noted, there were other pieces that we were working to address. For example, one of the things, as you may be aware, is MCPS was one of the first school districts in the metro area to have a plan to provide instruction to students when they were in quarantine. In order to provide that instruction during quarantine, though, that is something that staff are doing on top of what they would have done normally. And so that is one thing that has consumed a significant amount of time for staff members outside of the classes that they typically teach. In order to address that, one of the things that we are doing and was shared at the Board of Education meeting is looking at how we can provide a cluster model, or especially at the elementary school level, to provide that instruction, because we do want to have that instruction available while students are in quarantine. But I did just want to acknowledge, all that DHHS is doing. We're very grateful for that. And while contact tracing was one of the things that was mentioned, there are other things, and we are continuing to collaborate with the employee associations to think about how we can best support our staff, who have done just a tremendous job over the past 6 weeks as we transition students back into the building. Before I share the data points that we were asked to share just very briefly, I do also want to highlight a couple of other updates for all of you. The first one is, as you are probably aware, one of the 5 points that Dr. McKnight outlined in her COVID-19 5-point plan was the creation of a COVID-19 dashboard. That was being created in an effort to share the data in a more user-friendly format than just posting the community letters. As you may be aware, that dashboard was initially posted last Tuesday. After it went live, it became apparent that there were some discrepancies appearing between the number of cases appearing on the dashboard and the number of cases that were reflected in the community letters that had been posted. And so as a result, we removed the dashboard temporarily and have manually been reviewing every single letter and every single case on the dashboard to make sure that everything is perfectly aligned. That process is expected to be completed by tomorrow, and we plan to repost the dashboard on Thursday. I also want to just give a brief update in alignment with what Council Vice President Albornoz mentioned in terms of the medical officer that we are seeking to hire. So we've received a number of applicants at this point and are now in the initial stages of reviewing those applications. The next step for us will be scheduling interviews and the other steps in the selection process. And we anticipate having someone presented at the Board of Education meeting for appointment in early November. And we recognize that that person will play a critical role in continuing to build on our relationship with DHHS as we work together to ultimately keep schools safe and keep students in school. And then the last quick update before I share the data points that we were asked to share is one of the things that you were also aware of from Dr. McKnight's 5-point COVID-19 plan is the campaign that we have been working on called Say Yes to the Test. And there is an extensive amount of work that has happened and will continue to happen to encourage families to opt in so that students can participate in both rapid testing if they have symptoms in school, as well as our screening testing program. And so I just wanted to highlight one thing that happened as a result of that effort. This past Saturday at Paint Branch High School was our Say Yes to the Test Day, one of many community activities that we are conducting in order to increase the number of families that opt in. And so we worked with a number of community partners to host this particular event. And so there were opportunities to opt into testing, to get vaccinated, and then also to learn about school system and community resources. And at the same time, we had staff out knocking on doors, as well as posted at multiple shopping centers to distribute information about the campaign. And families have the opportunity to complete forms on paper at that time, or we give them the information if they would prefer to complete the information online. So in terms of the data points, I know that we have a limited amount of time, so I'll just very briefly touch base on the data points that we have been asked to share. The first one is to give an update on the screening testing. And so at this point, as of this week, it's being implemented in 141 of our schools. As of last Friday, more than 28,000 tests had been administered, and of those, only 18 came back positive. And as we shared at the previous county council meeting, this effort for screening testing is continuing to expand to all schools throughout the month of October. As you may recall, originally our plan was just to do screening testing in grades pre-K through 6, but a decision was made as one additional effort to keep schools safe to expand this to all school levels. So throughout the remainder of October, this is expanding to all 209 of our schools. I also do want to just briefly highlight the data around our positive cases by week, as well as this number of students entering quarantine each week. You will notice for the last 2 weeks since we've had our last county council briefing, the numbers have remained relatively stable. The number of students who have tested positive has gone down slightly. The number of staff who have tested positive has increased slightly, but all in all, the overall numbers are relatively consistent for the past few weeks. In terms of the number of students entering quarantine, once again, the last 2 weeks are reflected at the bottom of the screen. The past 2 weeks were both 5-day weeks for students, but that information is on the left side for your reference as well. We are continuing in alignment with the guidance that DHHS has provided not to quarantine any close contacts of individuals who are just symptomatic. It is quarantining for close contacts of students who have tested positive. And so you can see the numbers have continued to remain significantly lower than they were at the beginning of the year, when during the first week of the school, there were more than 2,000 students who had entered quarantine, whereas for the last 2 weeks, the numbers have hovered between 396 and 455. And again, we are continuing to work with schools and partner with DHHS to do everything that we can to keep those numbers as low as possible, and really making sure that at the end of the day, our goal is to keep all schools safe and students in school to the greatest degree possible. So with that, I will now turn it back over to Council President Hucker.
Thank you so much. That's very helpful. Councilmember Reamer.
Thank you. I think I've actually had a lot of my questions addressed for now, but let me give it a little bit of thought as we go through the queue, and then I'll come back. Thank you.
Sure. Councilmember Glass.
Thank you very much. Good conversation this morning on a variety of aspects to keeping everybody healthy and safe, and making sure that county government is able to provide those services to everybody. And I'm just looking at some of the notes that I was taking and some of the questions, and similar to Councilmember Reamer, I appreciate Mr. DeAndrea's comments, which have answered a bunch of mine. But I guess on the last slide that we just saw regarding the number of individuals, number of students who are quarantined versus the close contacts, can you explain just a little bit more? I see I saw that the numbers have trended down to 0 for some of the close contacts, but there are still, thank you very much. Putting this one back up. Can you explain the difference between those two columns once again?
Absolutely. Thank you very much, Councilmember Glass. And I apologize. I should have gone into more detail on this particular slide. I know I had shared some at the previous meeting, but just to highlight the information and why the change in the right column versus the left column. So at the beginning of the school year, when you look back at the first row, in accordance with the HHS guidance, students were being placed into quarantine if they were close contacts of someone who had tested positive, which is reflected in the second column, or if they were close contacts of someone who had COVID-19 symptoms. And so for the first 2 weeks, you see numbers in both the second and the third column. At the end of the second week, there was a change in the guidance. And as a result of that, only students who were close contacts of students who tested positive were determined to need to quarantine. And so that's why for the last 4 weeks, the number in the second column or in the third column is 0 all the way down. Then during the third week and going into the fourth week, the HHS mobilized very quickly to be able to implement rapid testing in all school health rooms in all 209 schools. So now if a student develops symptoms during the school day, they are, with parental consent, able to have a rapid test done in the health room. And if that test is positive, then the students close contacts will need a quarantine. If the student is negative, then they're determined not to have COVID-19, although they are strongly encouraged to get a PCR test, but then we do not need to quarantine anyone. So that's why you see then another very significant drop between the third and fourth week. And so for the fourth, fifth, and sixth week of school, the numbers have been relatively consistent between approximately 350 and 450. So significantly lower than before. Obviously, we're continuing to explore how we can get that number even lower.
No, I appreciate the explanation, and clearly we all recognize the importance of in-class education and how important it is. And so this information, this explanation is appreciated, recognizing the difference between a student who has tested positive for COVID and another one who might have sneezed or exhibited some other ailment that was not COVID, right? So I appreciate the difference there and taking that into action. The only other question I had, which you explained a little bit, was the process for the medical officer. And kind of going back to the conversation that my colleagues were having about HHS in general, one of the things that I'll just say, I don't know if it necessarily concerns me at this point in time, but I'm going to, raise a yellow flag about is, redoubling or reinventing levels of administration and, quite frankly, even bureaucracy, where the county right now is hiring for a chief medical officer, which our regulations require that person to be an MD. And then at the same time, having MCPS search for a similar person who is not required to be an MD. Maybe you can elaborate on that as well. But over the last 18 months, the relationship between MCPS and HHS has been so incredibly close, and guidance has been given to MCPS. And so now I'm curious if the hiring of this person means that there will be a formal break and that MCPS will not rely as much on county government, HHS and the executive team and council team. So can you explain the working relationship between this individual and MCPS and the county?
Definitely. Thank you very much, Councilmember Glass. And I appreciate that you raised those points because it is really important to note, I don't anticipate there being any break in the relationship between the school system and the county government. If anything, I anticipate that as a result of this new position, that the relationship will grow even stronger. We have a strong relationship now and work together and communicate on a daily basis. I anticipate that this position will help us to do that even more effectively. And so the idea for this came as we explored what other school systems throughout the country have done. There are a number of school systems that do have a medical officer on board that's able to, especially with the pandemic going on, provide guidance on an ongoing basis to school staff. But for us, where we have a very strong Department of Health and Human Services in Montgomery County, we anticipate this individual being the primary liaison with the Department of Health and Human Services, and then again, helping to strengthen our relationship even more than it is at this point. So we don't anticipate in any way that there being a break and in any way changing the process in terms of how we collaborate and follow the guidance that DHHS provides. In terms of the requirements for the position, we have said in the job posting that someone that is a medical doctor, that is a preferred qualification, but we are just now in the early stages of reviewing all of the applications. So I don't have numbers on where we are in terms of how many individuals who are medical doctors have applied.
Okay, well, again, I appreciate that explanation. And one of the things that we're always concerned about here is stovepiping and creating more positions that sometimes create difficulties in the left hand communicating with the right hand. And while there have been these direct channels of communication, just want to make sure that whomever steps into this role is maintaining those conversations so that we all know what is happening and that we all move forward in the same step. So we will. I'll monitor. I don't know, Dr. Starter, did you just raise your hand?
I did want to chime in on this. First off, I think as Dr. Bridgers is finding out, being a health officer in the middle of a pandemic is. I know he knew this before, but I'm sure he's learning every day that it's hard. And so I think that having MCPS having some internal expertise. I mean, frankly, and this is not a secret to anyone, there are the powers of a health officer are quite broad in state law. And so there's no world where MCPS or any other school district could ignore the advice and recommendations of a county health officer. But where I think would be really helpful for MCPS to have internal medical expertise is really around design and implementation of programs that are medically informed, but are aimed at servicing the school system. The school system itself is very large. So if you're the health officer of Montgomery County, you've got 1,050,000 plus residents to consider. Yes, they have overlap with many of the, of 160 plus thousand and 20 plus thousand staff in MCPS. But obviously, setting up programs that serve the school system are complicated in and of themselves. And so I think that would be really valuable is taking the combined working together of the health officer and the medical officer from MCPS, coming to consensus on good programming for MCPS, then having that medical officer go and design the programs and do so in concert with the health officer, instead of the health officer and public health having to develop all those programs on behalf of MCPS alone. We're not, we have knowledge because we have nurses in school health that are in the health rooms all the time, but we don't, I would not pretend that we're experts in the way that MCPS day in, day out is an expert in their system. And so I think this, if designed correctly, as we described, will be an excellent addition to MCPS and to the county's overall health and safety.
And so, Councilmember Glass, just to add, I know in my discussions with Dr. Kroll, HHS welcomes the support. Often in research and science, we look at how we review and analyze data, and we triangulate those data. So, as Dr. Stoddard indicated, from a school health standpoint, their medical officer would work in concert and collaboratively with our health officer or our chief medical officer, as it would be, as well as our community partners, as Councilmember Navarro indicated, our Care for Your Health, our mobile meds, all of our safety net, even our hospital collaborators as well, so that we would continue to add to that community of practice that has got us to a successful point where we are now with our high level of vaccinations, as well as we continue to plan for our pediatric vaccinations. So it's just a added string to our safety net, if you will.
And if I could also just chime in, the Office of the Chief of Staff within MCPS has really served to help coordinate and facilitate the work among all of our offices related to COVID-19, as we are a very large school system and have a number of offices that are all handling parts of the COVID-19 response. When this individual is hired, this individual will become a part of the Office of the Chief of Staff to make sure that there's a seamless transition, and again, to help coordinate all of the work that's happening throughout the school system and help to facilitate our working relationship with DHHS moving forward.
Well, I appreciate hearing all of your perspectives as to why this position is needed, and it sounds like it will be a value add. And as long as it doesn't add to any confusion and everyone understands, the org chart and the lines of communication and the delineation of authority, I think that will be a good thing. So let's let's keep being mindful of that. And as both medical officers are hired throughout our processes, I know that we have to hope that they have that collaborative relationship. They need to have that collaborative relationship for all of us, and you will keep us posted as that process moves forward. So thank you for this update today. Mr. President, I yield back.
Thank you, Council Member. This is great, everyone. Jimmy, did you happen to say how many on the Say Yes to the Test campaign you're running, how many students have gotten consent for testing from their parents?
So we are continuing to process all the information from over the weekend, but we are over 40,000.
Over 40,000. Okay.
Mm-hmm.
And did you have age and demographic breakdown or not?
I do not have that age and demographic breakdown this time, but we can have that information for our next briefing.
Did you describe what type of communication is going out to families and whether that's being done in a culturally competent way?
So there is a variety of communication going out to families in various formats in multiple languages. We are very conscious of making sure that whatever communication that we send as a school system, we obviously need to make sure we are communicating in ways that align with the language preferences of our families.
Absolutely. Are you logging at all the concerns that you're hearing from parents about why they wouldn't want to opt in to be tested?
We have had a number of conversations with individual parents, and whether that's at the school level, I'm speaking on behalf of the school system, or at the school system level, and are looking at ways to best address those concerns moving forward. Absolutely.
Okay, and thanks for doing this at Paint Branch. Councilmember Rice, Chairman Rice.
Thank you very much. So it's good to hear on a number of levels that the case counts continue to go in a positive direction. And, we've had a couple spikes, Dr. Bridgers, with the updates, we've seen some that have been in the 100s, but we've seen them as low as, I think the last one was 23 cases, right? So, and then Mr. DeAndrea, in the school system, we're seeing increased testing and seeing the numbers trend lower. So that's great news. And so that's positive. But it also means that what we're doing is working. I want to just make sure that folks understand and put those two pieces together and not think that those things aren't just happening just because. It's because of our mask mandate. It's because of the work that we continue to do and making sure that folks follow the best practices possible. It doesn't just happen in a vacuum on its own. It happens because of the great work that continues to go on. And I want to thank Councilmember Albornoz and Councilmember Navarro for highlighting the fact that we are going to have this meeting as we continue to do so with our partners, with both education and HHS, as we continue to collaborate throughout this on best practices and how best we move forward to make sure that we're keeping our students and administrators and staff and families of those students all safe in our greater collective community. I will just say that it will be important for us to be mindful that every single fall we do have spikes. And as Councilmember Glass was noting, the sniffles is one piece, but we do have full-blown flu outbreaks. I know my daughter had the flu 2 years ago, and it's one of those where, again, it doesn't happen often. I mean, I fortunately have been getting my flu shots and didn't have the flu before COVID came about. Unfortunately, didn't contract COVID, got vaccinated, but it's one of those where we are going to see those cases increase in terms of those that look similar. And so it will be imperative for us to make sure that we can delineate, which is why the testing in schools matters so much. And I would just like to encourage and just take this moment, as we did this weekend, with encouraging folks to please opt in for testing so that we can discern whether or not your child has in fact been infected with COVID, much more serious than the common flu, and so that we can get them treatment and protect the rest of the greater school community. So I just wanted to make that little bit of a pitch for folks to continue to make sure that they opt in for having their students tested. And then I just wanted to make one last comment. We'll talk about this in greater detail when we do have our joint committee meeting, but it is one that deals with Montgomery College. I know that the governor has reached out to community colleges throughout the state to talk about the nursing cohort. And many of you know that both my mother-in-law, who works at Holy Cross as a nurse, and my sister-in-law, who works at a nursing facility as a nurse, what we heard about nursing shortages and nursing burnout is real. I was at dinner with my family on Saturday evening and heard it firsthand from both of them. We also had a brand new transition in the software that our hospitals use that happened, and that created some challenges for a lot of folks. There's so much that's going on right now in the healthcare space that it is going to be imperative for us to make sure that those that are working even longer hours now and even under more constrained conditions have some sort of respite. And so that's going to come by creating additional pathways so that more folks can get into this field, a lucrative field, quite honestly, and one in which I agree with Councilmember Hucker. We do need to always look at what we're looking at for pay and make sure that it's commensurate with the great job that they continue to do in this space. But I will just say that for a lot of folks who may be in other kinds of career pathways, who may be unemployed at this time, I encourage you, seek out the programs at Montgomery College and others, and give yourself another opportunity and another pathway that is going to be one that we'll need for a very, very, very long time. It's not going anywhere. Nursing isn't going anywhere. The healthcare system may be changing a little bit with the infusion of technology, but the reality is we still need those people. And so, that's my other pitch, is to make sure that those of you who are out there who are thinking about different kinds of careers to go into, we encourage you to please utilize the programs that are at Montgomery College now that will be increased, hopefully based on state support and an overall nationwide initiative for us to really start pushing to address our nursing shortage. So it's more of two kind of sound bites, Mr. President, more than anything else, but just want to make sure that folks are aware and just really want to, again, thank everybody for their continued partnership and working together. We know what the problems are, and I think we know how to solve them, but it's not easy. It's going to take some time and it's going to take some investment. So I look forward to working with all of you on that.
Thank you. Council Vice President Albornoz.
Thank you, Mr. President. Very much appreciate the comments of my colleague, Councilmember Rice, just then. Just a couple questions. Dr. Bridgers, just to be clear, I know we're working on the infrastructure and foundation to be able to disseminate the vaccinations to kids between 5 and 11. And I know we're working with the state on any guidance, but will there be a pre-registration process as there has been in the past? And how will families, where should they look for the opportunity to pre-register their children so that they can be in the queue to receive the vaccination? First question. And related, I assume, but wanted to confirm, as far as we know, that the other providers, our supermarkets and pharmacies, will also be given dosages. So once again, families will have multiple options on where they can pre-register or register their children to receive the vaccination. If you can just be more clear on that, that'd be helpful.
Sure. Thank you, Council Vice President Albornoz. Mr. O'Donnell, if you're still on, could you put up a plan and just walk through the registration process? I don't have it in the queue. While you do that, I will speak to the second part of Council Vice President Albornoz's question. Yes, we've worked with our community providers. So we're working, which goes back to my reference to a community level query to see whether or not those grocery store spaces, those pharmacies, those other spaces, providers in general, one, will have access to the vaccine. If they have access via Immunet, that will significantly increase our capacity to vaccinate faster and in greater numbers. And so we're working on that level of detail now, absent of any plan from MDH, but as part of our planning and contingency operations. We've worked extensively, again, with our community partners and our safety net clinics to ensure that they have access to Immunet so that they can get vaccines directly, again, which will increase our capacity to get more shots in arms. And so once we get our data responses from the survey, we can gauge and determine in those areas in an equitable framework, those spaces that will have either greater access or fewer access, and use those as touch points to provide additional vaccine, again, We don't know how the vaccine will roll out, if the guidance will be based on a population, whether or not we receive 35 doses a week, and whether or not that allotment will include the distribution to our community partners who have access to Immunet. So that's an unknown right now, but we are taking all of those into consideration. And so, Mr. O'Donnell, hopefully that answered your question, Council Vice President Albanos.
It does. I guess the headline here is we don't know exactly yet. We believe so, and we're waiting for more information.
Absolutely. Absolutely. Great summary. Mr. O'Donnell, do you have the information queued up?
All right. So just to address first how we're getting more providers onboarded, we have added right to our vaccination page links to more information for those providers about how to get registered with the state. Right now, it's we've tried to simplify it. I could click on the PDF here. It gets much more detailed, focused on what those providers need to have as far as refrigeration, reporting, and all of that. But we have tried to simplify it. We've had communications directly with our providers going back to May to get as many onboarded as possible. Again, those that are vaccine for children providers already who traditionally serve the pediatric populations, that process is a lot easier to go through, but it is a registration with the state to be listed to have a COVID PIN. And if you have a vaccine for children PIN, again, it's much easier to do. But for those providers who don't traditionally do it, they can still do it. There's just an application process with the state. And again, I won't go through all of that, but what we have done is, and we've shared this previously in our reports, we've asked the state periodically for updates on how many providers are currently giving vaccine and how many of them have registered to be able to give vaccine. And it's very encouraging. It's over 2/3 of our providers who do pediatric practices, and a growing number of the family practices that are currently doing it, currently administering vaccine already, and the vast majority of our pharmacies as well. We are working on a letter that we will push out through the medical society and to our providers as well, encouraging them and reminding them that they can sign up.
Terrific. And for parents that are out there wanting to look at pre-registering their kids, that obviously isn't set up yet because there's a lot of pieces we have to put in place. But when can we anticipate the opportunity to do that in addition to working through your own pediatric provider and the pharmacies and the other networks? When will the county have its pre-registration process set up?
We're still looking into how we'll roll that out. It's a little bit different with the much larger number of providers that have the ability to give out vaccine, as opposed to previous uses of the pre-registration list, where again there was really a very limited supply at the time and a very limited number of places you could go. So we had to make a much more extensive use of that process. So right now we're still evaluating how to use that pre-registration list.
Got it. So the general message for parents who are anxious, and I'm one of them, full disclosure, is that there will be a number of providers, more providers available this time. And so there won't be the need, as there has been in the past for previous waves of the vaccination, for the same robust pre-registration system that we had before, because there will be many more providers. And as we have more information on exactly the number of providers, we will be providing information for families on where to go, how to do it, and just stand by. Information will be coming, bottom line.
Yes, and we do link to these search engines through our website, so that individuals know that it's more than just where the county sites are. In fact, when you go through our website with the vaccination opportunities, we include a lot of those community partners and the clinics they're doing as well on our website. And that's through the see available locations, dates, and times. But we also have links further down about clinics run by other organizations, and you can find locations near you and make appointments. And this one will take you to the Maryland page where providers who are in the same place all the time have registered. Again, I don't think that every private provider is registered through this site, but we encourage individuals to contact if you have a pediatrician or a private provider, to contact them directly and ask them if they intend to give out vaccines and how to schedule an appointment for that. But this is a great tool for looking up and seeing where you can go to get a vaccination site, and it's fairly easy to work through. Again, you can call our call center and we'll help people find sites if they're having challenges navigating this website.
Great, I appreciate that. And then I guess just my last couple of questions are comment/question. There is some evidence nationally based on some of the surveys we're seeing that there may be a little bit more reluctance from families with younger children to sign their kids up as quickly as they may have for their adolescent children. And so we will have to be more intentional, as we have been all the way through in our messaging, to ensure that as the tremendous turnaround that we had with our older children, we receive the same for our younger children. And so just Dr. Bridgers, if you could talk a little bit about what some of the plans are for those families that, understandably may be a little hesitant to be first in line, but want to be among the first in line. If you can talk a little bit about messaging directed at those families so that we get everybody in the queue as soon as possible.
Sure. Thank you again for a great question, Council Vice President Albornoz. First and foremost, we strongly encourage all parents to have their 5 to 11-year-old vaccinated. We have worked and continue to work with our information to provide the best information. We've also worked with our providers and raised questions about pediatric vaccination or vaccine administration to ensure that it is a comfortable space for our 5 to 11-year-olds to receive a vaccination, similar to going to a pediatrician's office. In our local static sites, our high throughput sites, we've worked extensively to look at those administration techniques in our providers and our clinicians. We provided information and resources to make sure and ensure that it is a seamless process to ease any fears that our parents have. And so we will continue to work with our communication department to have information about the efficacy of the vaccine, to look at those best practices and strategies for administering the vaccinations. And so all of these conversations, these great conversations, are occurring with our community partners and our providers because, again, their input is paramount. They have the information, the community level knowledge to determine and identify and direct us to those spaces where we know we should and can administer those doses. And so we're working with our clinicians to make sure that they are culturally sensitive to the needs of various communities, because how one provider administers a vaccine in one setting may be quite different in another setting. And so we've taken those nuances, those cultural nuances into consideration. Short answer is, we will make sure that our spaces are comfortable and convenient for parents to take their children to get a shot.
Love it. I'll save the rest of my questions for when we have that joint session in a few weeks, because we've touched on a lot of it. One of the things I will touch on that we've all described and is a deep concern for all of us is that burnout and the strategies that we can utilize to provide some respite for families, for the children themselves, and of course, for our providers and school staff and administrative staff. The burnout rate is very high, and we're all exhausted on this call, I know, but the folks on the front line are just really feeling it. So I'll save those questions and thoughts when we have the joint session, but thank you all. This has been another productive and helpful work session.
Councilmember, I want to add one piece to this, and I think it's an important thing when we talk about the 5 to 11-year-old vaccinations. The other really, in addition to the health benefits, the other really big feature of vaccination is that when you are identified as a close contact, you do not have to quarantine if you are vaccinated. And so when we think about these school-based quarantines that we're all so very concerned about for very good reason, our most expedient way to address quarantines in schools is to get kids vaccinated when they're eligible. And so obviously I mean, if you're a parent who's a little bit on the fence, the fact that your child maybe, have to be out of school for 10 days, and you then in turn may have to be out of work to care for said child for 10 days, is a pretty significant benefit to the vaccine, even when you don't even consider the health benefits that we know. And I think Dr. Schnicker showed earlier the hospitalization things. They're not high, but they're a lot higher when it's your kid in the hospital. So just think about it that way. So certainly encouraging people to get vaccinated with health benefits, but also the quarantine benefits is key.
Great. Thank you very much, Dr. Stoddard. I yield back to you, Mr. President.
Thank you so much. Councilmember Reamer.
Great comment there, Dr. Stoddard. Thanks for reminding us and reminding our parents that keeping their kids, in school will be aided in a lot of different ways by getting vaccinated. I just had a quick question, probably for MCPS that may have been addressed already, but the dashboard on the internet, what's the timeline to have that functioning? It's got some data issues at this time.
Yes, thank you very much, Councilmember Reamer. So after it was initially posted, it became apparent that there were some discrepancies between the data that was appearing in the dashboard and the number of cases that were reported in the letters that are posted on the website. So it was removed. And then we've been manually reviewing every single one of the letters and every case that was in the dashboard. That process is expected to be completed tomorrow. And then the dashboard will be reposted on Thursday.
Okay, great. So coming soon. Just a very general comment. I have a hard time. I'm sure that this county is the most highly vaccinated county of our size in the country. No question. A large share of our population works for the NIH or the FDA. I'm not so sure we're really 99.1%. I find it hard to square that with, for example, other data showing vaccination rates in certain census tracts as low as 50%. So, wherever we are, I don't know exactly. I'm sure it's very high, but I think maybe a little more, I think we should not, for our own purposes, assume that actually 99% of eligible residents are vaccinated. I just, somehow that it just seems improbable to me. I'm sure it's a very high number. But somehow that just strikes me as, again, improbable that 99% plus. So not to kind of rain on a parade, but I just think as we are thinking about, what it means and what we're doing here, it's just a little bit of a different thought pattern if you think most everybody, but not necessarily literally everybody. Dr. Stoddard, do you want to comment on that?
Yeah, I think obviously we have no reason to doubt the CDC, but I think there's, when you see 99.1%, I think that, if maybe that's 97, maybe it's 95, it's right. High, but maybe there's some discrepancy there that you're right. We need to account for, because we don't have the data that CDC has. We can't possibly answer the question of, are there duplicates that they're picking up? We don't know that. We don't have their data set. There are about 100,000 residents who've been vaccinated according to the CDC that we do not have in the Maryland database because they weren't vaccinated in the state of Maryland or through a part, so for example, if you were vaccinated at the FDA, you'd go straight up in the CDC system without going through Immunet. And so there's no way for us to know necessarily whether it's 100,000 or maybe it's actually only 40,000. And that difference is meaningful, as you said, but we just don't know. We haven't seen the line list of names that are in the CDC registry that are generating that 99%.
So if you got one shot in one place and then you went somewhere different for a second shot and they had to do some quick manual work to create a all those things could create a discrepancy. We don't really know. It's possible. So I just think, again, you think a little bit differently about it if you think maybe 90% or, something like that. It's like, yeah, almost everybody, but it's not probably everybody. So, Okay, thank you. Appreciate that.
Okay, thank you, Councilmember. Councilmember Friedson.
Thank you. Appreciate the update. Several of my questions were asked, so I won't belabor them. And I do think, just reiterating the point earlier, we've all heard from the school health nurses, and we've heard from school personnel, and look forward to that ongoing conversation and to get an update on how this contracting is working, since it seems like that has not worked as well as we would like. And so certainly please keep us updated on that as well. I did just want to follow up. I appreciate that the data dashboard is going to be put up. I had heard earlier Thursday, I know Councilmember Reamer noted that, we want to get it right, but we want to make sure we have it. We've also heard some concerns that the medical officer description had been taken down. I understand you're going through the interview process and you have a plan to come to the Board of Education, as you've noted in November. I think it would be helpful for residents to know what you're looking for, even if you don't have a candidate yet, and even if you're not seeking applications, if you keep the description for that up and available, just so everybody understands what that position is expected to do. So I just wanted to note that. I think it was taken down. I understand why. Normally when you have a job posting and it's no longer available, you take it down, but there's such community interest in this beyond applicants for what this individual is going to do, what the scope of responsibilities are going to be. I think it would be helpful to the public if that was publicly available.
Thank you, Councilmember Friedson. We can definitely put that on the website. It was not taken down for any other reason. That the position posting expired after the.
I get it. It's probably, standard protocol. Job is no longer posted, but I do think it would just be helpful in the interest of understanding, given how much of an issue this is for residents, and how it largely was something that stakeholders had requested and that you have tried to follow through on, I think, which we all appreciate. So that would be really helpful. And just in terms of the numbers, I just want to note for all of us, whether it's the county numbers or the CDC numbers, none of these numbers are perfect. I just think we have to acknowledge that and realize that. We're basing our numbers based off of population, which is always going to be an inexact science. I think the key here is the trends, and to really understand where we are in reference to where we were, where we believe we need to be consistent with the numbers that we've used. That's why I acknowledged earlier the CDC numbers have been challenging because they have changed the way they've calculated it, which I think has really caused more confusion than it's solved, and has made it very difficult for us here at the local level to follow the moving target. But I do think the larger point of us being careful how much we are focused on it. I mean, it is true to say we're the most vaccinated place, among eligible people, most fully vaccinated for large jurisdictions. That is true. Exactly, if that number is 99.1%, or if it's a little bit lower, a little bit higher, it's still true, and it still is an acknowledgement of how our residents have stepped up. And I strongly believe that when 5 to 11 become eligible, that will continue like it did when 12 to 15 became eligible, and frankly, were our most efficient group getting vaccinated. And that was true, across the population and across the county. So I look forward to that being true. Just final question on this, and it relates to both HHS and to the school system. I know we're talking about community sites and community partners in the schools. Could you just give us an update of what the thought process is for the number of sites that you would be looking at once 5 to 11 becomes available, and how you're approaching those questions and those issues, where those sites would be, how many sites you would expect to have, how much staffing would be required, and who would be staffing them?
So thank you, Councilmember Friedson, for that. I can't go into any detail right now because it's in progress. We've identified, we want to make sure that they are equitable and accessible. We want to make sure that they are on transportation transportation routes or walkable or bikeable routes. We've even had some considerations regarding those particular spaces of schools that we've used in the past. So we haven't finalized those details. So that's why I can't give any specific schools as whether or not we're going back to Paint Branch or, another school. We're working on that now. One thing that I can say in my communications with the Maryland Department of Health is that we will not be going into every school and administering or setting up a pod at over 209 school sites. That's just not practical based on the resource challenges that we currently have. And so we're looking at those schools where, one, we see lower vaccination rates, we see access and equity challenges as we've done before with the previous sites. And we're using some of the lessons learned from our 12 to 15-year-old vaccination strategies that we have as far as the schools and the lessons learned and the impact and the ease and the staffing that we've used for that. So I can share that with you now regarding the planning for that and subsequent conversations as we get closer, perhaps on the next Board of Health update to council. We will have the schools identified and we can delineate those schools and the staffing and the resource needs for them.
Yeah, we have identified a number of places to do the vaccination. It's just how many of them get used will in part be dependent on how much we get of the total share that's given to Montgomery County. So if we get a bigger share, we'll do more sites. But if there are more community sites, we'll intrinsically just do fewer county sites because we won't have, number one, the vaccine to distribute, but there will be so many other opportunities in the same area. And so when we talk about an equitable distribution strategy, we're going to be looking at the overlay of where pediatricians, grocery stores, other pharmacies are, and who has access to the vaccine based on Immunet, and then placing our larger clinics in the context of those sites. And so we've identified a staffing number for different sites, a number of different sites already. It's a matter of how many of those sites will get utilized. And to be clear, it's not just the public schools that we're thinking about. We are looking at the larger non-public schools as well, because they're just as entitled to receive the vaccine as anyone else is. And so we're going to look at large sites that are geographic in nature that can serve non-public and public school students at the same time in those places. So I think Dr. Bridges is exactly right. We next meet on the 26th with you all. I would guess by then that we will have a much more specific locations, even times and weekend, all that kind of stuff. I think will be a much better place to talk about 2 weeks from now, just because the state will have at that point presumably given us some information about what we're likely to see.
Appreciate it. As soon as you can provide that to us, I think it would be helpful. And I just strongly encourage a combination of large sites and mobile and pop-up sites, and that they be distributed. I mean, we have learned very quickly that the easier and more accessible we make this, the more culturally competent we make it, the better adoption we get. So, we know what works. We've seen what works. You all have been doing, a really good job, and hopefully you'll continue to do that. And if, there could be a hybrid strategy that does both the large permanent sites and then, has flexibility on moving the sites so that we can make sure that we're getting into every community to the greatest extent possible. I think that will go a long way to hitting the goals, both that initial surge of 25 to 30% over the first 2 weeks, but then also the balance of those who are eligible that may not be running to get this right when it comes out, wherever it is. And we need to go closer to them based on obstacles that they may face in order to get it. So thank you for that. Appreciate it, Mr. President.
Just to add again and to reiterate, our community partners will be instrumental in having that capacity to be in mobile spaces, static sites, fixed sites, et cetera.
Thank you. Okay, I think that's all the council members who wanted to speak. Very much appreciate all your hard work at HHS and MCPS. We're looking forward to future updates and very grateful for your partnership. Thank you so much.
Thank you. Stay safe and get a flu shot, everyone.
Okay, next, colleagues, for item 3, we will conduct interviews for our applicants for the Montgomery County Planning Board. Action is tentatively scheduled for October 26th, 2021. Are our nominees with us? Thank you for your patience. Hi, Ms. Rubin. Mr. Pinero, are you with us?
Mr. President, it's one at a time for these.
Oh, beg your pardon. Okay, thank you so much. Not clear from my notes. Welcome, Ms. Rubin. I think everyone here knows you. We're so grateful to have you. First question, I have 6 questions and we'll see if my colleagues have any additional ones. First, why do you want to become a member of the planning board and what do you hope to accomplish?
Well, as an adult, I chose Montgomery County to be my home, and I've enjoyed the benefits and opportunities that the county has provided. They're fabulous. I raised my children here, and I can't imagine actually living anywhere else, which means I really would like to provide or be part of the solution to provide the same opportunities to all current and future residents of Montgomery County. So it's important to understand that I am inherently a public servant. I have been in public service almost my entire career. And actually, I think I've been working 35 years for this opportunity. And public service isn't just a calling to me. It's actually in my blood. It's what makes me tick. And the way I've operated as a public servant is under the premise that knowledge is power. So my style has always been to help people understand the issues that impact their lives so that they can use that knowledge and advocate for their own interests. So beginning with redevelopment of Silver Spring, where I learned the value of listening and learning to the community I served, then working in the private sector, it taught me a practical approach to solving challenges, both legal and business. And then when I returned to the public service sector, it was interesting. My children even told me that my spark had returned. So I knew that it was my calling. And my experience most recently as with the commission, Park and Planning Commission, started as working on park acquisitions for conservation, development for recreation, overseeing complex issues related to the ICC, which of course has helped me apply those lessons to the my most recent challenge, which has been the managed lanes study. But one of the most important lessons that I've learned throughout my career is the power of land use as an economic development tool. And that's important. So if you all give me the opportunity to continue to serve this county as a planning board member, I would like to accomplish the following. I want to enhance the relationship between the planning board and the communities it serves by building on my reputation as both an honest broker and a creative and critical thinker. I would like to create more cohesive interagency collaborations at early stages of planning and design of public facilities. For example, I would love for the planning board to be working closer with MCPS on school design to meet the county's goals for Vision Zero, more than just mandatory referral review. I think that's important. And finally, I would like to continue to work with you all, with our elected officials, as a demonstrated and trusted advisor, always with the goal of helping accomplish what we do best in Montgomery County. What I find and what I love about Montgomery County is we don't simply fix problems. We seize on those opportunities to improve the life of all our residents. And that's, so I certainly hope that I have the opportunity to continue to serve.
Thank you so much. What do you believe are the most critical issues the planning board should focus on over the next few years?
Okay, well, there are many. Clearly, we need to provide more housing opportunities, and those opportunities run the gamut of the socioeconomic scale. Recent census data has shown that Montgomery County is growing with more low-income residents than ever before, and so we need to intentionally create housing for our most vulnerable populations, while also addressing affordable housing needs for others by increasing our inventory. So we really need to pay attention to the regional housing targets that have been set by COG. I believe that we need to provide a balanced and affordable regional transportation system, enhancement of education opportunities for all, and continuing the great work of our Parks Department by creating more and better open spaces and effectively using the park system assets. And then finally, job growth. We have to grow our jobs in order to pay for all this. And but while doing so, we must take into account what Council President, what you referred to as the Great Resignation. We have challenges in our labor market because of labor shortages in some of those markets. So what we need to do is address these issues, but I think we need to do that looking through three lenses. One is always through the lens of racial, social, and environmental justice. The second lens is we always need to take into account the impact that these issues will have on our natural resources through a climate impact lens. And finally, we have to focus on addressing these critical issues with a regional view, because fences don't always make great neighbors. I think we need to break down those fences and work with our regional partners very closely.
Thank you. How will COVID-19 change the planning in the county in the future, and what impacts do you anticipate the planning board will need to address? For example, how will COVID-19 affect the need for commercial zoning in the future for office space or for park usage and operations?
Okay, so I think the fundamental issue that you need to look at is really how the impacts of COVID and what they result in. It's really about where, when, and how we work, live, and recreate. So we have more work at home, and that will clearly impact the use of standard commercial office space. But at the same time, we're expanding the time that we all spend in our home offices. So when we think about street activating or street level activating uses on ground floor of commercial buildings, we probably should look at more community serving uses on those ground floors to assist in the growth of work from home. I think that COVID is going to flatten the peak travel times for transportation systems. It's not just about, there are a lot of cars on the road, but the question is, when are those cars on the road and where are they going? I also understand that, I see that I participate in more online shopping. And I think that will also change some of the traffic patterns, but we can't look at it in a vacuum, because although there may be less trips to brick and mortar stores, there's increased delivery systems for the packages. So, we need to consider that also, unless of course drone delivery evolves. And if we get drone delivery, then that's another area we're going to have to look at. So when and how, and really important is when and how we recreate, such as expansion of outdoor seating for restaurants. It's clear that we've seen an increase in outdoor leisure activities in our parks, on our parkways and roads, by people biking more and walking more. And that's going to have a definite impact on the design of complete streets. So I think we're going to have to look at it that way as well, to make room for bikes, pedestrians, and streeteries. So fortunately, though, I believe the planning board and the county has started planning or addressing how we plan for COVID, because we're focusing on walkable and compact communities. And I think that is going to help a lot.
Agreed. So you mentioned this lens earlier. How, if appointed, how will you position this role to work on racial equity and social justice issues?
Okay. Well, as a member of the Commission's Diversity Council for the last 2 years, I was on a appointed group to advise the commissioners with recommendations to develop and implement a diversity, equity, and inclusion policy framework. And that framework addressed both internal operations, such as hiring standards and promotional opportunities, which are very important when you're looking at equity, and the external policies, like how we're expected, both the planning board and the planning staff, to work with the communities we serve, all the communities, and meaningful engagement in our community members and our partners, to acknowledge, understand, and address their needs, their concerns, are really important. It's a federal practice that has been used often, and I believe that I'm pushing this as part of, or had been pushing it before I retired, as part of the Managed Lanes Environmental Justice Task Force. I hope as a member of the planning board, I can continue to operate in a different role, but on that same committee. But anyway, and as some examples during COVID, it created with our online hearings. I think it's created opportunities for much more participation at hearings by those residents who may not have that opportunity otherwise because they're trying to hold down their jobs and and they just can't get away to attend a hearing in person. And so I believe that that's an example of a continued approach. It's an opportunity that we should just glom onto and continue it in some fashion. And finally, the policy that the commission has adopted requires periodic measurement for its implementation and its success. And if appointed, I intend to be front and center as a commissioner to address and make sure that there is continued success and always looking at ways to better implement those policies.
Thank you. Are there any potential conflicts of interest of which we should be aware, and will you be able to make the time commitments required to fulfill the responsibilities of a planning board member?
I have no conflicts in this regard. In fact, I retired specifically for this opportunity. I moved up my retirement so that there would be no conflicts as a staff person, and I will absolutely dedicate the time needed for this position.
Great. Are there any other questions for Ms. Rubin? Great. Oh, Councilmember Reamer.
Just wanted to say thank you, Mr. Rubin, for applying. Your incredible career in public service is just an amazing calling card. Really appreciate your service. Thanks.
Thank you.
I think all of us have enjoyed working with you, Ms. Rubin, and really grateful that you're willing to put yourself forward for this position.
Thank you, and I really appreciate the opportunity to do so.
Okay. We're behind, so forgive the brevity. It's great to see you. Thank you for your answers, and we'll move on to Mr. Panero.
Great, thank you.
Thank you so much. Hi, Mr. Panero.
Hello, can you see me?
Yes, we can. Thank you for being here again.
Yes, well, thank you, Council President Hooker. I appreciate the fact that you've invited me to be on this interview again. To me, it's an honor to be here. So again, I want to thank you. I want to thank the council members for this opportunity.
We're so glad you're here. Thank you. First question is, why do you want to become a member of the planning board, and what do you hope to accomplish?
Well, let me just say a few things about me, because people are probably wondering, who's this guy with this funny accent applying for this position? You know, I grew up in Puerto Rico, where I've lived, I've lived all my life, except 30 years ago, I moved to Montgomery County. I have been very fortunate to live in this county and very fortunate to raise my 3 kids and my 2 grandchildren who just spent 2 weeks with me recently. And I come from a bicultural environment. Many times I feel like an immigrant here, even though I'm a US citizen, because I grew up in Puerto Rico, although now people are learning about Puerto Rico after the hurricane. But many people would ask me, is that a foreign country or whatever? So anyway, we use Spanish as our main language. So I do identify with many immigrants who come here and have struggled throughout the year. So I was recruited back in Puerto Rico about 32 years ago from GAO, a congressional agency, to work as a housing specialist. And I've done that in the area of housing and community development. Now, again, I feel that my experience at GAO gave me that critical skills to fine-tune my academic background in city planning. While I was working at the federal government, I decided to volunteer in many capacities, in many boards, Family Service Agency, MCPS, a budget committee. I did, but I guess the most important is HOC, where I worked for 12 years, 4 of them as the chair. I was selected by my peers. Now, when I joined HOC, I remember Ralph Bennett, and then later on, Norm Dreyfus saying it was great to have an urban planner on the board. So my interest in, I find this vacancy is a good fit for me as a city planner and somebody who has served on many boards. I think it's different, the kind of skills that you develop when you're on a board. You need to be kind of independent and critical of the agency and the staff and the director. It's not, when you've been a staff member of that board, of that agency, you bring a different perspective. And like I said before, I don't want to be a rubber stamp. I don't want to just simply, when I was at HOC, we would encourage dissent within the board. So if people had different, issues, or we would many times put the as they say, the fire on the feet of the staff, just to be sure that what they were recommending was what we agreed to. So I think the main issues that I'm interested in are, of course, affordable housing, transportation, and environmental issues. And I think I can, having served on the county, also as commissioner, as the chair of the Interagency Commission on Homelessness, I hope I can still contribute to the county.
Thank you. What do you believe are the most critical issues the planning board should focus on over the next few years?
I think, definitely more housing for everyone. I think we need to start attracting more young folks into the county, competing with Northern Virginia and DC. I think as we develop more housing, we're going to have to develop more affordable housing. I also think that we need to, be serious about the I-270 and the 495 and the north-south corridor in transportation, and find a way of relieving some of the congestion that we have. I think some of this, the I-270 is, I was a little bit concerned when I saw that I think the planning board was recommending a long-term plan to deal with what they call the corridor, and looking at 15 different options. I think we're pretty sure about what we need to do in terms of the I-270. We need more transit. We need either a light rail or a monorail. I think many times when we think about, doing a study, I remember when I worked for GAO, and the minority and the majority at the Hill couldn't get into agreement, and they said, well, let's have GAO do a study. And that's like kicking the can down the road, not doing something about it. I think we need to prepare and have an action plan of how we're going to deal with 270 in terms of either a light rail or something. I don't think it needs to be studied anymore. So that's my opinion. Again, if I were lucky enough to get the position, I would see what the planning board thinks about this. I also think that there's a need for more parks and open spaces, and of course, economic development, job growth. We need that in the county.
Right. How will COVID-19 change the planning in the county in the future? What impacts do you anticipate the planning board will need to address? For example, how will COVID-19 affect the need for commercial zoning, for office space, or for park usage and operations?
Yeah, I think it's, COVID-19 has affected everything. It's changing, for example, I do some consulting for CDFI, and there's been a lot of projects where there's been vacant commercial space, and they're thinking about reusing that commercial space for housing or for other purposes, same with office space. So, we need to be open to we need to have an open mind in terms of what can be done. I'm a big proponent of mixed use development and mixed income development. So we need to, each parcel is going to have to be looked separately and see what what we do with it. The pattern of transportation also may change as more people are working from home right now and using less transit. It's the demand for housing is changing too, as people's preference for housing, as more people are leaving the inner city and moving to the suburbs. We should have. I've seen that in my neighborhood. I live in the Aspen Hill area, where I've lived for the last 32 years, and I've seen many young professionals moving in because they can work from home and they can telework. So, those are areas that COVID definitely has affected. I think the parks, we've seen a more demand for urban parks. And I'm very concerned about eviction, the possibility of evictions, even though it hasn't come to fruition. We may see an increase. I know the federal eviction laws have changed, but the county is still protecting people here not to be evicted. But what will happen once we start getting some evictions going, that it may increase in the future. And the COVID is also affecting the number of jobs. Many people have lost jobs, and it's got to be a priority in terms of the after effects of the impacts of the coronavirus. Oh, I'm not hearing you.
Sorry. If appointed, how will you position this role to work on racial equity and social justice issues?
Well, I think I would be suited for this, in part because both County Council Navarro and the big shoes that Natalie Fanny Gonzalez have left as a vice chair of the planning board, it's I think they're big shoes to fill for whoever you appoint to the planning board. They have done a great job not only in terms of transportation, environment, housing, but especially Council Navarro. I know her term limit is coming up next year, but she's done a great job of incorporating the immigrant community and bringing in people who were outside of the planning process. The same with Natalie. And so what I expect to do in terms of racial equity and social justice, I mentioned it before, I want the planning board to look like especially the executive staff, to look like the rest of the county, making a great strides on this. But I think each agency should implement a diverse staff. And externally, I want to see how the master plans and what kind of metrics they adopt in terms of either having more housing development or changes to just how the regulation affects the price of housing. We also need to look at the impact on racial equity and social justice, looking at affordable housing and the impact on the cost of housing.
Thank you. Are there any potential conflicts of interest of which we should be aware? And would you be able to make the time commitments required to fulfill all the responsibilities of a planning board member?
I don't have any conflict of interest. I retired from a GAO, and I've been doing some consulting for Treasury on the CDFI, but I've told them I would recuse myself with anything that has to do with Montgomery County. I also feel that I don't have any relations. I've never worked for the planning board. I don't have any appearance of conflict of interest or any real conflict of interest. It's, I think the role, to me, the role of a board is there's a fiduciary responsibility to keep a distance from the staff and to basically set the vision and the strategic plan and provide oversight. It's not really to duplicate the work that the staff does, but to keep an open and critical mind of what things are working and what things are not working. It should be inclusive, participatory, and look at new ideas to encourage citizen participation. When I worked for the HOC for 12 years, we had people who had worked for HOC as staff members or executive staff, and they applied to be on the board. We told them, no,
Right.
they should not be on the board because it affects the independence of the board. Thank you.
Okay, glad to hear that. Thank you, Mr. Panero. Any comments from or questions from my colleagues? I don't see any. Terrific. Mr. Reamer.
Just wanted to again thank Mr. Panero for his service to the county over the years. You're a familiar face to us, and we know of your good work, and I really appreciate it. So thanks for your work at HOC, and appreciate your application today.
Thank you very much.
Well said. Thank you for putting yourself forward. We'll get back to both of the nominees very soon. Thank you so much for your willingness to serve.
Council President, bye.
Thank you. Bye-bye. All right, colleagues, for item 4, we'll have action on the county executive's appointments for the Assistant Chief Administrative Officers, Ms. Sonia Mora and Yakov Jake Weissman. I know we're all very excited about these nominees, and I remind colleagues we're behind. Is there a motion to approve these appointments?
So moved.
Councilmember Reamer moves. Councilmember Katz seconds. All those in favor, please raise your hand. There we go. That is unanimous. Thank you so much. All right. Congratulations to both of you. We're looking forward to working with you. Next, item 5, we'll take up the consent calendar. Councilmember Tawando moves. And is there a second? Councilmember Reamer seconds the consent calendar. Let me I'll recognize myself very briefly. I want to just say how proud I am to continue service on the Washington Suburban Transit Commission, grateful to the county executive for renominating me. That, of course, is the oversight body for the county and Prince George's County and the state. All the Maryland members to oversee the Washington Metropolitan Area Transit Authority, WMATA, for our public rail, bus, and paratransit planning and policy issues, the backbone of our economy. I'm glad that in my first term, I was one of the few board members to advocate to stand up our first website and modernize the commission that way, and to manage the commission through a very difficult drop in rail ridership during the pandemic and a huge revenue shortfall. It's very important that we continue to have a voice on this commission so we can continue our projects to move forward. Both the operating budget and the capital budget for Washington Metro, transit planning and policy is very, very important, I know, to all of us, and serves the residents of Montgomery and Prince George's County. So I'm looking forward to continued collaboration with my colleagues on the WSTC Commission to create greater transit opportunities over the next few years. I also wanted to express my concern about a nominee for the library board. And I was going to suggest that we separate out these nominations to allow the county exec to explain his choices for the board. My concern is not about the board, which does outstanding work, or any of the current members or other nominees. My concern is only about a single nominee, Mr. Rippion. When we passed our racial equity and social justice policy back in 2019, spearheaded by Councilmember Novato, we committed to using that lens to make all our decisions. And the Government Alliance on Racial Equity that we hired to move that program forward defined racial equity as when race can no longer be used to predict life outcomes, and life outcomes for all groups are improved. And we all consider, I know, racial equity and social justice as urgent moral, socioeconomic endeavors for our community. Our population is continually changing, and that didn't happen overnight. And I know all of us consider racial equity not only an ethical obligation that we feel, but essential to ensure the continued economic vitality of Montgomery County, which was in the statement that we agreed to when we adopted that lens. But Mr. Rippion has taken public positions and made statements that don't align with that shared vision. In one interview with Montgomery County Media, MC Media, he said parents were to blame for the county's persistent achievement gap, with white and Asian students outperforming African American and Hispanic students. In a follow-up interview, he said, quote, "The children come with an achievement gap that shows the parents are not doing the things necessary for their own children to succeed in school. The learning that goes on in school should supplement the learning that goes on at home. It should not be a substitute or replacement for it." And a Cumberland Times News article included quotes from him that said that the candidate, well, their reporting was that the candidate does not believe that babies born in America to parents who are in their term, illegal aliens should be granted citizenship. Legal immigration should be allowed based on the individual's skills, not on unification of families, Rippion said. English should be officially recognized as the national language, and that government involvement tends to create problems, citing housing, healthcare, and student loans as examples. So personally, I'm uncomfortable with anybody who has concerns about Medicare, Medicaid, Obamacare, and student loans, but not fracking, and another one of his public positions. In light of all the importance that we place on county amenities, including our libraries, serving the needs of our entire community equitably without bias towards anyone's status or their background, I would suggest we hold the nominations for the library board and allow the county executive to provide some additional information about how he chose this individual for this important post. I hope we can address those quickly so we can continue to have a library board that reflects our values, particularly our commitment to equity for all those residents. Councilmember Friedson?
No, I'm fine with removing that. Does there have to be an amendment to the motion? I think, perhaps.
Yeah, we would just, I can't make a motion. But, so I know Councilmember Albornoz and Navarro, I know also had some concerns, but I'll take a motion from anyone in a second.
Well, I would think just offer as a friendly amendment that we remove item H from the consent agenda, if the movers would accept that.
Second.
Okay, Councilmember Rice moves, seconds, Councilmember Duando's on board. Okay, great. All those in favor of removing the library board from the consent calendar, please raise your hand.
Well, I think we can just, I think we just take, it was accepted as a friendly amendment. So
it was a friendly amendment. You're right.
Item H and approve the consent agenda.
So that's it. Is there anyone else who wanted to speak? If not, great. Let's vote on the consent calendar. All those in favor of the consent calendar, please raise your hands. Terrific. Thank you all. The consent calendar is now approved, and we can move on to item 5.5, which is a work session and action on amendments to the comprehensive water supply and sewer systems plan, including some water and sewer category change requests. As you all know, but just for the benefit of the public, the county's Department of Environmental Protection is responsible for reviewing and approving category change amendments. However, they can't deny a request that falls under the responsibility of the council. The planning board reviewed these category changes on September 9th. They sent their recommendations to us. We held a public hearing on September 14th, and a T&E committee work session was held on September 30th, 2021. After a review and discussion, the committee recommended deferring on 2 requests and denying 1. So let me turn it over to our outstanding staffer, Mr. Levchenko, to provide some more information on each request and the committee's votes.
Okay, yes, as noted in the packet, there were 3 category changes in this package. I've listed them in the cover page as 1, 2, and 3. The first 2 items were discussed jointly by the committee. The properties in question in those 2 requests are actually both at the same intersection on Trevilla Road and the intersection with Glen Road in Potomac. They both relate to redevelopment proposals requiring a long extension of sewer service to serve both properties. So the committee really took them up together, as did the planning board as well during its review. And ultimately the committee opted for deferral of these 2 requests. It recognized, as did the planning board, that we don't have a master plan or master plan support for sewer for this area or for these 2 properties. Nor do we have an existing water and sewer plan policy that we could also point to for these 2 properties. However, there was interest in the committee, general support for the intent of the proposals, and there was interest in the committee in
pursuing or seeking a policy in the water and sewer plan that could be considered by the council that would address these properties or could address these properties. We happen to have a comprehensive update coming over to the council expected later this calendar year or near the end of this calendar year. So there is an opportunity as part of that process for the council to consider a potential policy that might affect these properties. So based on that, staff has crafted a resolution text with deferral language that notes that action would be deferred pending consideration of a special service policy in the water and sewer plan to address public service for commercial uses outside the planned water sewer service area. So, and that's basically what these two properties are seeking. I can get into more detail with regard to these properties if you want, if you like, but that was the general recommendation of the committee for those first two requests. And these were the TransQuest LLC request and the Travilla Oak LLC request.
Okay, Councilmember Reamer.
We don't have to have much discussion, but I just wanted to sort of iterate, as Keith was saying, we were talking about whether commercial property could be treated a little differently from residential property, because the applications are really strictly for the revitalization of some aging commercial properties that wouldn't allow residential properties to connect. And so that's what we were trying to seek is as an approach where, you know, we could add a targeted inclusion. So something that the community around there is really excited about, without having unintended consequences, you know, that might start opening up a cascade of residential properties for connections. So we felt a little bit hesitant to kind of write that on the fly, and we'll ask our department to try to craft that and, you know, take it through the process and bring something back to us for consideration. Thanks.
Thank you. Okay, so is there a motion to approve the committee's recommendation on the first two?
So moved.
Councilmember Reamer moves, Councilmember Rice seconds. All those in favor, please raise your hand. Terrific. Mr. Levchenko.
There's the third request, unrelated to the first two, is for a vacant property in the Glen Hills area of Potomac. The applicant is seeking public sewer service to provide for a development of a single-family home and accessory dwelling unit. The council actually reviewed the Potomac subregion master plan's recommendations and in specific the Glen Hills sewer service policy a few years ago, and made some adjustments to it based on a study done by DEP. However, this property would still not be eligible under those criteria that were established in that recent policy. So the committee recommended denial of this request. So unlike the other two requests, which would be coming back or expected to come back in the near future, this is a straight denial based on the once again, the master plan recommendations for the area and the recent Glen Hills policy that was amended in the 10-year water and sewer plan a few years ago.
Okay. All those in favor, can I get a motion in support of the committee's recommendation to deny this application?
So moved.
Councilmember Glass, for a second. Councilmember Katz, great. All those in favor of the committee's recommendation on this proposal, raise your hand, please. That is unanimous. Okay, thank you so much, Mr. Levchenko. Great, colleagues. Now we can break for recess until 1:30. Thank you so much.